5 videos in, 58 comparisons completed. And if you have been following this series from the beginning, you have built a foundation of knowledge about cat care that places you in a category so rare that most veterinarians will be surprised by the depth of your understanding when you walk into their clinic. You know more about nutrition, behavior, environment, and welfare than 99% of cat owners globally. And the decisions you make for your cat are informed by evidence, rather than by assumptions, marketing, or tradition. But there is one category of decisions we have not yet addressed in depth, and it is the category that most directly affects whether your cat lives 15 years or 20 years, whether they experience preventable disease or remain healthy into their senior years, and whether the money you spend on their care is spent effectively on interventions that work or wasted on products and services that provide minimal benefit. That category is health and prevention decisions, the choices you make about vaccinations, parasite control, dental care, diagnostic testing, and all the other medical interventions that are marketed as essential, but that vary enormously in their actual necessity and effectiveness. This is part 5, and this video covers 10 health and prevention decisions that will determine your cat's long-term health outcomes. And that will save you from spending money on unnecessary interventions, while ensuring you do not skip the interventions that genuinely matter. These are not the emergency medical decisions you make when your cat is sick or injured. Those decisions are made under time pressure, with limited information, and are heavily dependent on your veterinarian's guidance. These are the preventive care decisions you make when your cat is healthy, the routine maintenance interventions that either prevent disease or fail to prevent disease, depending on whether you implement them correctly. And the stakes are high, because the cumulative effect of preventive care decisions over a cat's lifetime is the difference between a cat who remains healthy until advanced age and a cat who develops preventable chronic diseases in middle age that compromise their quality of life and shorten their lifespan. The difference between a cat who keeps their teeth into their senior years and a cat who requires dental extractions and who experiences chronic pain from periodontal disease. The difference between a cat who is protected from the diseases that vaccines prevent and a cat who is over-vaccinated with boosters they do not need, experiencing injection site reactions and unnecessary immune system stimulation. Let's be clear about what this video is and what it is not. This is not veterinary advice that replaces consultation with your veterinarian. These comparisons provide the background knowledge that allows you to have informed conversations with your vet, to ask the right questions, to understand the reasoning behind recommendations, and to make collaborative decisions rather than passively accepting whatever protocol your clinic happens to follow. Your veterinarian has training and clinical experience that this video cannot replace, but you have responsibility for your cat's welfare and the right to understand the interventions being recommended. And this video gives you the foundation to exercise that responsibility effectively. If you are new to this series, welcome. You are starting with part 5, which means you have missed the foundational comparisons in parts 1 through 4 that cover nutrition, behavior, environment, and specialized care decisions. Those earlier videos are linked in the description, and while this video stands alone, the complete series provides the comprehensive education that transforms good cat owners into exceptional cat owners. Subscribe to this channel so you do not miss the remaining parts in this series and the other in-depth content we produce on every aspect of cat care. Let's get into the comparisons that will protect your cat's health and save you from wasting money on interventions that sound important, but that do not deliver meaningful benefit. Comparison 1. Dental treats versus toothbrushing. Dental disease is one of the most common health problems in domestic cats, affecting an estimated 70 to 80% of cats over 3 years of age, and the progression from early gingivitis to severe periodontal disease, with tooth loss, chronic pain, and systemic bacterial spread to organs including the heart and kidneys, is preventable through interventions that most cat owners either do not implement at all or implement incorrectly using products that provide minimal actual benefit. The dental care market for cats is enormous and includes treats, chews, water additives, food formulations, and specialized toys, all marketed as providing dental health benefits. And the abundance of products creates the impression that dental care is easy and that simply purchasing the right treats will protect your cat's teeth without requiring effort or technique from the owner. The reality is that most dental products for cats provide minimal plaque and tartar reduction compared to the gold standard of mechanical plaque removal through toothbrushing. And the choice between relying on dental treats and committing to regular toothbrushing is the choice between accepting that your cat will probably develop dental disease that will require professional cleaning under anesthesia and potentially tooth extractions, and preventing or significantly delaying dental disease through home care that actually removes the bacterial plaque that causes periodontal disease. This comparison examines what dental disease is and how it progresses, what dental treats actually accomplish and what their limitations are, what toothbrushing provides, and how to implement it successfully, and how to make informed decisions about dental care based on your cat's risk factors and your realistic ability to maintain different interventions. Let's start with what dental disease is and why it matters, because understanding the disease process clarifies what interventions need to accomplish to be effective. Dental disease in cats begins with plaque, the soft bacterial film that accumulates on tooth surfaces within hours after eating. Plaque consists of bacteria, food particles, and saliva proteins, and it adheres to teeth in a sticky layer that provides the environment where bacteria multiply and produce acids and toxins that damage gum tissue. If plaque is removed daily through mechanical action before it hardens, it does not progress to disease. If plaque remains on teeth for 24 to 48 hours, minerals from saliva begin to harden the plaque into tartar, also called calculus, which is a hard mineralized substance that adheres firmly to tooth surfaces and that cannot be removed by brushing or chewing, but that requires professional scaling to remove. The progression from plaque to gingivitis to periodontal disease follows a predictable sequence. Plaque accumulation causes gingivitis, the inflammation of gum tissue that is the earliest stage of dental disease, and that is reversible if plaque is removed. Gingivitis causes red, swollen gums that may bleed during eating or toothbrushing, and it is painful enough to affect eating behavior and quality of life even at this early stage. If plaque and tartar continue to accumulate, gingivitis progresses to periodontal disease, which is inflammation and infection of the deeper structures supporting the teeth, including the periodontal ligament and the bone of the jaw. Periodontal disease is not reversible and causes progressive bone loss, gum recession, tooth loosening, and eventually tooth loss. The pain from periodontal disease is chronic and severe, though cats hide it remarkably well. Cats with advanced periodontal disease may continue eating and may show no obvious signs of pain to their owners. But when the diseased teeth are extracted and the pain is eliminated, the behavioral changes are often dramatic. Owners report that their cats become more active, more social, more playful, and more interested in food after dental extractions, revealing that the cat had been suffering chronic pain that was affecting their entire quality of life. But that was not obvious until it was relieved. The systemic health consequences of periodontal disease extend beyond the mouth. Bacteria from infected gums enter the bloodstream and can seed infections in distant organs, including heart valves and kidneys. The chronic inflammation from periodontal disease contributes to systemic inflammatory burden that affects overall health and potentially contributes to shortened lifespan. Preventing periodontal disease is not just about keeping teeth. It is about preventing chronic pain and systemic disease. Now let's talk about dental treats and what they actually accomplish, because the marketing claims and the evidence are often misaligned. Dental treats are products formulated with textures, shapes, or ingredients claimed to reduce plaque or tartar through mechanical action, during chewing, or through chemical action from active ingredients. The most common formats are crunchy treats with abrasive textures, chewy treats that require extended chewing time, and treats with enzymes or other active ingredients claimed to break down plaque or prevent tartar formation. The Veterinary Oral Health Council, or VOHC, is an organization that evaluates dental products and awards a seal of acceptance to products that meet specific standards for plaque or tartar reduction demonstrated through controlled studies. The VOHC seal indicates that a product has been tested and has shown at least some measurable benefit, though the magnitude of benefit varies, and the seal does not indicate that the product prevents dental disease, only that it reduces plaque or tartar to some measurable degree. The plaque reduction from dental treats, even those with VOHC approval, is modest. Studies show plaque reductions in the range of 10 to 20%, compared to control groups receiving no dental intervention, and tartar reduction is similarly modest. This level of reduction may slow the progression of dental disease, but does not prevent it. And cats receiving dental treats as their only dental care intervention still develop gingivitis and periodontal disease at rates that necessitate professional dental cleanings. The mechanism by which dental treats provide benefit is primarily mechanical abrasion during chewing. The texture of the treat scrapes against tooth surfaces during biting, removing some plaque through physical contact. The effectiveness depends on the cat actually chewing the treat, rather than swallowing it whole, which many cats do, particularly with small treats or treats that are highly palatable and that the cat is motivated to consume quickly. Treats that are swallowed without chewing provide zero dental benefit, regardless of their formulation. The coverage limitation is significant. Dental treats only clean the surfaces of teeth that come into contact with the treat during chewing, which is primarily the large chewing teeth, the molars and premolars, on the side of the mouth where the cat chews. The canine teeth and incisors receive minimal to no contact with dental treats, and the inner surfaces of all teeth receive no cleaning from treats. This means that even with optimal chewing behavior, dental treats leave significant portions of the dentition uncleaned and vulnerable to plaque accumulation. The chemical action claims for treats with enzymes or other active ingredients are less well supported by evidence than mechanical action claims. Some dental treats contain enzymes like glucose oxidase that are claimed to break down plaque, but the effectiveness of these enzymes, when delivered in treat form rather than in constant contact applications like toothpaste, is questionable. The treat is in the mouth for seconds, and the enzyme does not remain on tooth surfaces after the treat is consumed, limiting the duration of action. The calorie contribution from dental treats is a practical concern that affects their usability, particularly for overweight cats or cats on calorie-restricted diets for weight management. Dental treats are food, and they contribute calories to daily intake. Giving multiple dental treats daily to achieve maximum dental benefit can represent 10 to 15% of a cat's daily calorie needs, which either requires reducing meal portions to compensate or contributes to weight gain if meals are not adjusted. For cats who are already overweight, this trade-off is problematic. Now let's talk about toothbrushing and what distinguishes it from dental treats in terms of effectiveness. Toothbrushing is the mechanical removal of plaque from tooth surfaces using a brush, an enzymatic toothpaste formulated for cats. The brushing action physically disrupts and removes plaque before it hardens into tartar, and daily brushing prevents plaque from remaining on teeth long enough to cause gingivitis. Toothbrushing is the only home dental care intervention that has been demonstrated in controlled studies to prevent dental disease rather than merely slow its progression. The plaque removal effectiveness of toothbrushing is dramatically superior to dental treats. Studies comparing brushed cats to unbrushed controls show plaque reductions of 60 to 80% in brushed cats. And cats who receive daily toothbrushing from young age show minimal gingivitis and tartar accumulation even into senior years. The difference in dental health between brushed and unbrushed cats is visually obvious during veterinary dental examinations, with brushed cats showing clean teeth and healthy pink gums, while unbrushed cats of the same age show tartar accumulation and gum inflammation. The coverage advantage of brushing is complete. Brushing allows access to all tooth surfaces, including the inner surfaces, that dental treats cannot clean, and the canine and incisor teeth that receive minimal contact with treats. Proper brushing technique addresses the gum line where plaque accumulates most heavily and where gingivitis begins, providing prevention at the most critical location. The technique requirement for effective brushing is real and is the primary barrier that prevents most cat owners from implementing toothbrushing successfully. Effective brushing requires the cat to tolerate having their lips lifted, their mouth open slightly, and a brush moved across their teeth and along the gum line. Cats do not naturally accept this handling, and training the cat to tolerate brushing requires gradual desensitization, starting with touching the cat's face and mouth with fingers, progressing to touching teeth and gums, introducing the brush without paste, and finally brushing with enzymatic toothpaste. The training timeline for successful toothbrushing is weeks to months, not days. The desensitization process cannot be rushed without creating resistance and fear that makes future brushing attempts impossible. Owners who attempt to force brushing on cats who have not been trained to accept it create negative associations that make the cat actively resist toothbrushing, and that often make the owner give up on brushing entirely after a few failed attempts. The enzymatic toothpaste formulated for cats provides additional benefit beyond mechanical plaque removal. The enzymes in cat toothpaste, typically lactoperoxidase or glucose oxidase, help break down plaque and inhibit bacterial growth through chemical action that continues after brushing ends. Human toothpaste must never be used for cats because it contains fluoride and foaming agents that are toxic if swallowed, and cats swallow toothpaste rather than spitting it out. The daily frequency requirement for toothbrushing is non-negotiable for maximum benefit. Brushing every other day or twice weekly provides some benefit, but allows plaque to remain on teeth long enough between brushing sessions that tartar formation begins and that gingivitis risk increases. Daily brushing prevents plaque from progressing to disease. The commitment is approximately 2 to 3 minutes daily once the cat is trained to accept brushing, which is a modest time investment relative to the dental disease prevention it provides. The practical barriers that prevent toothbrushing implementation include the training time required, the difficulty of brushing cats who actively resist, the daily time commitment, and the owner's confidence in their ability to perform the brushing correctly. These barriers are real, and they explain why toothbrushing rates in cat populations are extremely low, despite clear evidence of effectiveness. Most cat owners know they should brush their cat's teeth, but most do not do it because the barriers feel insurmountable. Let's address the specific situations where each approach is appropriate and where the choice between them is clear. Dental treats are appropriate when the cat refuses to tolerate toothbrushing despite appropriate training attempts. The owner has physical limitations that prevent performing brushing. The owner's schedule genuinely does not allow for daily brushing commitment. Dental treats are used as supplemental intervention alongside less than daily brushing. Toothbrushing is appropriate when the owner is willing to invest time in training the cat to accept brushing. The cat is young enough that training can begin before dental disease has developed. The owner can commit to daily brushing as part of routine care. The goal is to prevent dental disease, rather than merely slow its progression. The combination approach that uses both toothbrushing and dental treats is common and provides more benefit than either intervention alone, though the incremental benefit from adding dental treats to an already effective daily brushing routine is modest. The primary value of combining approaches is during the training period for toothbrushing, where dental treats provide some dental benefit, while the cat is learning to accept brushing. The professional dental cleaning consideration is important, regardless of which home care approach you choose. Even cats who receive daily toothbrushing may eventually require professional cleaning to remove tartar that has accumulated despite home care, though the frequency of professional cleanings is dramatically reduced in brushed cats compared to unbrushed cats. Unbrushed cats typically require professional cleanings every 1 to 3 years once dental disease has developed. Brushed cats may not require professional cleaning until senior years, or may require it less frequently. The cost-benefit analysis over the cat's lifetime strongly favors toothbrushing despite the higher effort investment. Professional dental cleanings under anesthesia cost $300 to $1,000, depending on the severity of disease and the number of extractions required. A cat who requires professional cleanings every 2 years from middle age through senior years accumulates dental care costs in the thousands of dollars. A cat who receives daily toothbrushing and requires fewer professional cleanings saves significant money over their lifetime while experiencing better dental health and less pain. The verdict, toothbrushing, is the gold standard for home dental care in cats and is the only intervention demonstrated to prevent dental disease rather than merely slow its progression. The plaque removal effectiveness, complete tooth surface coverage, and disease prevention benefit of daily brushing are dramatically superior to dental treats. Dental treats provide modest plaque and tartar reduction that may slow the progression of dental disease, but that does not prevent it. They are a reasonable option for cats who cannot tolerate toothbrushing, or for owners who cannot commit to daily brushing. But they should be understood as a compromise intervention that provides some benefit, rather than as an adequate replacement for brushing. If your cat is young and has not yet developed dental disease, invest the time in training them to accept toothbrushing. Start with gentle handling of the face and mouth. Progress gradually through the desensitization process, and establish daily brushing as routine by the time the cat is 1 to 2 years old. The investment of weeks in training prevents years of dental disease and saves thousands of dollars in professional dental care. If your cat is older and has already developed dental disease, schedule a professional dental cleaning to address existing disease, and then begin toothbrushing training after the cleaning to prevent recurrence. Starting brushing on diseased gums is painful for the cat and creates negative associations that make training more difficult. If toothbrushing is genuinely not possible due to cat temperament or owner limitations, use VOHC-approved dental treats as a compromise intervention and accept that professional dental cleanings will be necessary more frequently. Monitor your cat's gums for redness or swelling that indicates gingivitis and schedule professional cleanings proactively before disease progresses to severe periodontal disease requiring extractions. Dental disease is preventable, painful, and expensive to treat. Toothbrushing prevents it. Make the investment in training and in daily brushing, and give your cat the gift of healthy teeth and pain-free eating for their entire life. Comparison 2. Vaccination, core only versus full protocol. Vaccination is one of the most significant advances in veterinary medicine and has prevented millions of deaths from infectious diseases that were once common and often fatal in cat populations. The development of effective vaccines against panleukopenia, feline herpes virus, and calicivirus transformed these diseases from major killers to rare occurrences in vaccinated populations, and the success of vaccination programs has been so complete that most cat owners have never seen a case of the diseases that vaccines prevent. This success has created a paradox where vaccines are simultaneously essential for maintaining population-level disease control, and where individual cats may receive vaccines they do not need because vaccination protocols have not evolved to match our current understanding of immunity duration and individual risk assessment. The question this comparison addresses is not whether to vaccinate your cat. Vaccination is essential and non-negotiable for core vaccines that protect against diseases every cat is at risk for. The question is whether to administer only core vaccines on evidence-based schedules that match immunity duration, or whether to follow full vaccination protocols that include non-core vaccines for diseases the individual cat may have minimal risk of encountering, and that include booster frequencies that exceed what current immunity research demonstrates is necessary. This comparison examines what core and non-core vaccines are, what the evidence shows about immunity duration and booster necessity, what the risks of over-vaccination are, and how to make informed decisions about vaccination based on your cat's individual risk factors rather than on one-size-fits-all clinic protocols. Let's start with what core vaccines are and why they are called core, because the distinction between core and non-core is fundamental to rational vaccination decisions. Core vaccines are vaccines that every cat should receive regardless of lifestyle or geographic location, because the diseases they prevent are widespread, severe, and represent significant risk to all cats. The core vaccines for cats are the FVRCP vaccine, which protects against feline viral rhinotracheitis caused by herpes virus, calicivirus, and panleukopenia, and the rabies vaccine, which protects against rabies virus. Panleukopenia, also called feline distemper, is a parvovirus that causes severe gastrointestinal disease with vomiting, diarrhea, and profound depletion of white blood cells that leaves the cat unable to fight infection. Panleukopenia is often fatal, particularly in kittens, and cats who survive often experience long-term health consequences. The virus is extremely stable in the environment and can survive for months to years on surfaces, which means indoor cats are at risk from virus tracked into the home on shoes or clothing, even without direct contact with infected cats. Feline herpes virus and calicivirus cause upper respiratory disease with sneezing, nasal discharge, eye discharge, and mouth ulcers. While these infections are less commonly fatal than panleukopenia, they cause significant illness and can lead to chronic problems, including persistent nasal congestion and recurring eye infections. Herpes virus in particular establishes lifelong latent infection that can reactivate during stress, causing recurring symptoms throughout the cat's life. Rabies is a fatal viral disease that affects the nervous system and that is transmissible to humans, making it a public health concern in addition to a cat health concern. Rabies vaccination is required by law in most jurisdictions, regardless of whether the cat goes outdoors, and the legal requirement exists because rabies exposure can occur through contact with wildlife that enter homes, including bats, and because unvaccinated cats who bite humans create rabies exposure risk that requires expensive and invasive post-exposure treatment for the bite victim. The immunity duration from core vaccines is much longer than traditional annual booster schedules suggest. Duration of immunity studies using antibody titer testing have demonstrated that cats vaccinated with FVRCP develop immunity that persists for a minimum of 3 years and likely for much longer, potentially for the cat's entire life after the initial vaccination series and a single booster. The 3-year booster interval for FVRCP is now recommended by the American Association of Feline Practitioners and by most veterinary colleges, replacing the outdated annual booster protocol that was based on vaccine licensing requirements rather than on evidence of immunity duration. Rabies vaccine duration also exceeds traditional annual booster requirements. 3-year rabies vaccines provide immunity for at least 3 years and likely longer, and these vaccines are legally acceptable in jurisdictions that require rabies vaccination. 1-year rabies vaccines exist primarily for legal and licensing reasons rather than because immunity duration is shorter. And the biological difference between 1-year and 3-year rabies vaccines is minimal to non-existent. Now let's talk about non-core vaccines and when they are appropriate rather than routine. Non-core vaccines are vaccines for diseases that only affect cats with specific risk factors, and the decision to administer non-core vaccines should be based on individual risk assessment rather than on routine protocols. The primary non-core vaccines for cats are feline leukemia virus vaccine, also called FELV, and feline immunodeficiency virus vaccine, also called FIV, though the FIV vaccine is rarely recommended due to significant limitations. Feline leukemia virus is a retrovirus that suppresses the immune system and that causes anemia, lymphoma, and other cancers in infected cats. FELV is transmitted through prolonged close contact with infected cats through saliva, blood, or nursing, which means the primary risk factor for FELV is outdoor access, where the cat may encounter and fight with infected cats, or living in multi-cat households where an FELV-positive cat is present, Indoor-only cats with no contact with outdoor cats, or with FELV-positive cats, have essentially zero risk of FELV exposure and do not benefit from FELV vaccination. The FELV vaccination decision should be based on testing status and lifestyle. All cats should be tested for FELV at adoption or when acquired, because many cats are infected as kittens before they enter their permanent homes. Cats who test negative for FELV and who remain indoor only do not need FELV vaccination. Cats who go outdoors or who live with FELV-positive cats should receive FELV vaccination. The vaccination provides good but not perfect protection, reducing infection risk by approximately 80% in vaccinated cats exposed to the virus. The FIV vaccine is controversial and is not recommended by most feline medicine specialists because the vaccine interferes with FIV testing by causing positive test results that cannot be distinguished from true infection. A cat who receives FIV vaccine will test positive for FIV antibodies for the rest of their life, making it impossible to determine if the cat is actually infected if exposure occurs. The inability to distinguish vaccinated cats from infected cats makes the vaccine impractical for most situations. An FIV vaccine is rarely used in current practice. The additional vaccines that some clinics offer include Bordetella vaccine for cats in boarding or shelter situations, and chlamydia vaccine for cats in multi-cat environments with known chlamydia problems. These vaccines address relatively minor diseases in most cases and are not recommended for typical household cats. Now let's examine the risks of over-vaccination. Because vaccines are not risk-free, and unnecessary vaccination exposes cats to adverse effects without providing benefit. Injection site reactions are the most common adverse effect of vaccination and range from mild swelling and soreness at the injection site to severe reactions including injection site sarcomas. Injection site sarcomas are aggressive cancerous tumors that develop at vaccination sites in approximately 1 in 10,000 to 1 in 30,000 vaccinated cats. The tumors are difficult to treat and often require extensive surgery, including amputation of affected limbs, if the injection was given in a leg. The low incidence means most cats will never develop injection site sarcomas, but the severity of the outcome when it occurs makes minimizing unnecessary injections a rational precaution. Allergic reactions to vaccines occur rarely, but can be severe and life-threatening. Anaphylactic reactions cause difficulty breathing, collapse, and potentially death if not treated immediately. Milder allergic reactions cause facial swelling, hives, and vomiting. Cats who have experienced allergic reactions to vaccines require careful consideration of future vaccination necessity and may need pre-treatment with antihistamines before vaccinations that are deemed essential. The immune system stimulation from vaccination is generally beneficial because it creates immunity, but excessive or unnecessary immune stimulation in cats with autoimmune conditions or immune-mediated diseases can potentially exacerbate those conditions. While direct causation is difficult to establish, conservative vaccination practices that minimize unnecessary vaccines are prudent for cats with immune system disorders. The philosophical shift in vaccination medicine over the past 2 decades has been from vaccinating as much as possible to prevent disease to vaccinating as much as necessary to prevent disease while minimizing unnecessary vaccine administration. This shift reflects better understanding of immunity duration, recognition of vaccine-associated adverse effects, and movement toward individualized medicine rather than one-size-fits-all protocols. Let's address the specific vaccination schedules for different life stages and risk categories. Kitten. Vaccination schedule. First, FVRCP vaccine at 6 to 8 weeks of age. FVRCP boosters every 3 to 4 weeks until 16 to 20 weeks of age. Rabies vaccine at 12 to 16 weeks of age. FELV vaccine series. If outdoor access or FELV positive cat exposure is anticipated, The multiple FVRCP boosters during kittenhood are necessary because maternal antibodies from the mother cat interfere with vaccine effectiveness, and the timing of when maternal antibodies decline varies between individual kittens. Giving multiple boosters ensures that at least one vaccine is given after maternal antibodies have declined enough that the kitten can respond to the vaccine. Adult vaccination schedule after kitten series. FVRCP booster 1 year after completing kitten series. FVRCP boosters every 3 years thereafter. Rabies booster 1 year after initial rabies vaccine. Rabies boosters every 1 to 3 years thereafter, depending on vaccine type and local law senior cat vaccination. Continue 3-year FVRCP boosters unless titer testing demonstrates adequate immunity. Continue legally required rabies vaccination. Consider discontinuing non-core vaccines if lifestyle has changed to eliminate risk. The titer testing option allows measuring antibody levels to determine if the cat has adequate immunity without administering a booster vaccine. Titer testing costs more than vaccination in most clinics, but it provides individualized assessment of immunity status and can justify extending booster intervals beyond 3 years for cats who maintain high antibody levels. Titer testing is particularly valuable for senior cats, for cats with previous vaccine reactions, and for cats with immune-mediated diseases, where minimizing vaccination is desirable. The indoor-only cat vaccination question arises frequently, with some owners questioning whether indoor cats need vaccination at all. The answer is yes for core vaccines, because panleukopenia virus stability in the environment means indoor cats are at risk from virus exposure through contaminated shoes or clothing, and because rabies vaccination is legally required regardless of lifestyle. The answer is no for non-core vaccines like FELV in truly indoor-only cats with no exposure risk. The clinic protocol compliance pressure that many owners experience comes from veterinary clinics that continue to recommend annual vaccination, despite current guidelines recommending 3-year intervals for core vaccines. Some clinics tie annual examinations to vaccination, creating the impression that the cat cannot receive wellness care without receiving vaccines. This practice is outdated and does not align with current vaccination guidelines. Annual wellness examinations are recommended and important, but annual vaccination is not necessary for most adult cats. The verdict core vaccines, including FVRCP and rabies, are essential for all cats and should be administered according to evidence-based schedules that include a complete kitten series, a booster, 1 year after the kitten series, and subsequent boosters every 3 years for FVRCP and every 1 to 3 years for rabies, depending on vaccine type and local requirements. Non-core vaccines, including FELV, should be administered only to cats with specific risk factors, including outdoor access or exposure to infected cats, and should be discontinued if lifestyle changes eliminate the risk factor. Over-vaccination with unnecessary boosters or unnecessary non-core vaccines exposes cats to vaccine-associated risks, including injection site reactions and allergic reactions, without providing additional disease protection beyond what appropriate vaccination schedules already provide. If your veterinary clinic recommends annual core vaccine boosters for your adult cat, ask about 3-year vaccination protocols that align with current guidelines. If the clinic insists on annual vaccination despite your concerns, consider seeking care at a clinic that follows current evidence-based vaccination guidelines. If your cat is indoor only and your clinic recommends FELV vaccination, ask about the risk factors that justify the vaccine. If no risk factors exist, declining FELV vaccination is appropriate and does not represent neglect of preventive care. Vaccination is essential medicine that has saved millions of feline lives. Appropriate vaccination means administering the right vaccines at the right intervals to the right cats based on individual risk assessment. It does not mean administering every available vaccine on the shortest possible interval regardless of necessity. Be an informed advocate for your cat, understand what vaccines they actually need, and ensure they receive appropriate protection without unnecessary exposure to vaccine-associated risks. Comparison 3. Regular deworming versus fecal testing. Intestinal parasites are common in cat populations and range from minor nuisances that cause minimal health impact to serious pathogens that cause significant disease, weight loss, anemia, and in severe cases, death. The approach to parasite control in cats has traditionally been preventive deworming on regular schedules, using broad-spectrum dewormers that kill multiple parasite types, operating under the assumption that parasites are common enough that treating all cats regularly is more efficient and more protective than testing individual cats and treating only those found to be infected. This blanket treatment approach is still recommended by some veterinarians and is the standard protocol in shelters and catteries, where parasite prevalence is high and where the cost of testing exceeds the cost of treating all cats presumptively. But in individual household cats, particularly indoor-only cats with minimal exposure risk, the question arises whether regular preventive deworming provides meaningful benefit over fecal testing to identify infections and treating only when parasites are detected. This comparison examines what intestinal parasites affect cats and how they are transmitted, what the risks and benefits of regular deworming versus testing-based treatment are, what fecal testing can and cannot detect, and how to make informed decisions about parasite control based on your cat's individual risk factors and lifestyle. Let's start with what intestinal parasites commonly affect cats and what the transmission routes are, because understanding exposure risk clarifies whether preventive deworming is justified. The most common intestinal parasites in cats are roundworms, hookworms, tapeworms, and various protozoan parasites including Giardia and Coccidia. Each has different transmission routes, different health impacts, and different susceptibility to deworming medications. Roundworms, specifically Toxocara cattii, are the most common intestinal parasite in cats and are particularly prevalent in kittens. Adult cats become infected through ingestion of roundworm eggs from contaminated environments or through predation on infected rodents or birds. Kittens can be infected through their mother's milk, which means even indoor-only kittens born to infected mothers can have roundworms without any environmental exposure. Roundworms cause poor growth, pot-bellied appearance, diarrhea, and vomiting in heavy infections, and they are zoonotic, meaning they can infect humans and cause visceral larva migrans, a condition where roundworm larvae migrate through human tissues, causing organ damage. Hookworms are less common than roundworms in most cat populations, but are prevalent in warm, humid climates, including the southeastern United States. Hookworms attach to the intestinal wall and feed on blood, causing anemia that can be severe and life-threatening in kittens or in heavy infections in adult cats. Transmission occurs through skin penetration by larvae in contaminated soil or through ingestion of larvae from the environment. Tapeworms are transmitted through intermediate hosts, primarily fleas, and rodents. The most common tapeworm in cats is Dipylidium cananum, which requires flea ingestion as part of its life cycle. Cats become infected by swallowing fleas during grooming, and the tapeworm develops in the intestines, shedding segments that appear as small rice-like pieces in the cat's feces or around the anus. Indoor cats with effective flea control have minimal tapeworm risk, while outdoor cats who hunt rodents or who have flea exposure are at higher risk. Giardia is a protozoan parasite that causes diarrhea and is transmitted through fecal-oral contamination from contaminated water or surfaces. Giardia is common in multi-cat environments and in cats from shelters where close contact and shared resources facilitate transmission. Many cats carry Giardia without showing symptoms, making them silent carriers who can infect other cats. Coccidia are protozoan parasites that are particularly common in kittens and in stressed cats, causing diarrhea that can be severe in young or immunocompromised animals. Like Giardia, many cats carry Coccidia asymptomatically and only develop illness when stressed. Now let's talk about regular deworming protocols and what they accomplish. Regular deworming means administering broad-spectrum deworming medication on a scheduled basis, typically every 3 to 6 months, regardless of whether the cat has been tested for parasites or shows any signs of infection. The medications used for regular deworming are typically combination products that kill roundworms, hookworms, and sometimes tapeworms, but they do not address protozoans like Giardia or Coccidia, which require different medications. The advantage of regular deworming is that it kills parasites before they produce eggs or cause clinical disease, theoretically preventing the cat from experiencing illness and preventing environmental contamination with parasite eggs that could infect other animals or humans. In environments with high parasite prevalence, including shelters, catteries, or multi-cat households with outdoor access, regular deworming reduces overall parasite burden and reduces transmission risk. The broad-spectrum coverage of regular deworming addresses multiple parasite types with a single medication, which is convenient and ensures that common parasites, including roundworms and hookworms, are controlled without requiring specific diagnosis. This approach assumes that the prevalence of parasites is high enough that treating all cats is justified, even if many of those cats are not actually infected. The cost-efficiency calculation for regular deworming depends on parasite prevalence in the population. In high-prevalence situations, the cost of deworming all cats is less than the cost of testing all cats and treating only the infected ones. In low-prevalence situations, regular deworming means paying to treat many cats who are not infected, while testing would identify the minority who need treatment and would avoid unnecessary medication for the majority. The resistance development concern with regular preventive deworming is that frequent use of deworming medications in populations where many treated animals are not actually infected creates selection pressure for resistant parasites. While dewormer resistance in cats is not currently as significant a problem as it is in livestock, the principles of resistance development suggest that limiting dewormer use to situations where parasites are actually present is better stewardship than blanket preventive treatment. The medication exposure consideration is that all medications carry some risk of adverse effects, and administering medication to cats who do not have parasites exposes them to medication risk without providing benefit. Most dewormers are very safe, and adverse effects are rare. But in cats with sensitivities, or in cats taking multiple medications, minimizing unnecessary medication use is prudent. Now let's talk about fecal testing and what it can detect and what its limitations are. Fecal testing for parasites involves microscopic examination of a fecal sample to identify parasite eggs, larvae, or protozoan organisms. The standard fecal examination is a fecal flotation, where feces are mixed with a flotation solution that causes parasite eggs to float to the surface where they can be collected and examined under a microscope. More sensitive testing, including fecal centrifugation and specialized stains, can detect protozoan parasites like Giardia and Coccidia that may be missed on standard flotation. The detection accuracy of fecal testing depends on several factors, including the quality of the sample, the skill of the laboratory technician, the specific parasites present, and the timing of testing relative to the parasite life cycle. Fecal testing is good at detecting roundworms and hookworms when these parasites are actively producing eggs, but it can miss infections during the prepatent period before adult worms begin producing eggs, and it can produce false negatives if parasite egg shedding is intermittent. The tapeworm detection limitation is significant. Tapeworm eggs are contained in segments that are shed intermittently, and these segments are often not present in fecal samples submitted for testing. Tapeworm infection is often diagnosed by owner observation of segments around the cat's anus or in feces, rather than through laboratory testing. A negative fecal test does not rule out tapeworm infection. The protozoan detection requires specific techniques and cannot be adequately assessed through standard fecal flotation alone. Giardia detection requires immunoassay testing or specialized staining, and Coccidia require careful examination because the oocysts can be easily overlooked. Many general practice laboratories do not perform these specialized tests routinely, which means protozoans may be missed unless specific testing is requested. The sample collection timing affects accuracy. A single fecal sample provides a snapshot of parasite shedding at one moment in time. And intermittent shedding means that parasites may be present but not detected in a single sample. Multiple samples collected over several days improve detection accuracy, but the additional cost and effort make multiple sample testing uncommon in routine practice. The testing frequency question parallels the deworming frequency question. If fecal testing is used as the parasite screening method instead of preventive deworming, how often should testing occur to provide adequate parasite detection? Annual fecal testing at wellness examinations detects many infections, but it may miss infections that develop between annual visits. More frequent testing provides better surveillance but increases cost. Let's examine the specific situations where each approach is clearly preferable. Regular deworming is appropriate for kittens who have high parasite prevalence and who benefit from deworming as part of routine kitten care regardless of testing results. Outdoor cats with hunting behavior who have continuous exposure risk through rodent predation. Multi-cat households where one cat has tested positive, making transmission to other cats. Likely shelters and rescue environments with high parasite prevalence. Areas with high environmental contamination, where reinfection risk is continuous. Fecal testing is appropriate for adult indoor-only cats with no exposure to outdoor environments or to other cats. Cats in households where minimizing medication use is a priority. Cats with previous adverse reactions to deworming medications. Annual wellness screening to verify parasite-free status. The combination approach that uses both testing and treatment is common and represents a middle ground. Annual fecal testing at wellness examinations detects infections that require treatment, and treatment is administered only to cats who test positive. This approach avoids unnecessary medication for uninfected cats while providing regular surveillance that detects infections before they cause significant disease. The kitten protocol deserves specific attention because kittens are a special case where regular deworming is standard practice, regardless of testing. Kittens receive deworming medications starting at 2 to 3 weeks of age and continuing every 2 weeks until 12 to 16 weeks of age, then monthly until 6 months of age. This aggressive deworming schedule reflects the high prevalence of roundworms in kittens and the significant health impact of roundworms on growing animals. Fecal testing in kittens is often performed, but does not replace deworming, because negative fecal tests in kittens may reflect prepatent infections where parasites are present, but not yet producing eggs. The human health consideration affects parasite control decisions, because some feline intestinal parasites are zoonotic. Roundworms in particular pose risk to children who may ingest contaminated soil or who may not practice careful hand hygiene after petting cats. Households with young children benefit from regular fecal testing or deworming to minimize zoonotic risk, and scrupulous litter box hygiene and hand washing are essential preventive measures regardless of the parasite control approach used. The verdict: regular preventive deworming is appropriate for kittens, for outdoor cats with continuous exposure risk, and for multi-cat households or environments with documented high parasite prevalence. The broad-spectrum coverage and prevention of clinical disease justify regular treatment in these high-risk categories. Fecal testing with treatment only for positive results is appropriate for adult indoor-only cats with minimal exposure risk, providing adequate parasite surveillance while avoiding unnecessary medication use for cats who are not infected. The combination approach of annual fecal testing at wellness examinations with treatment, as indicated by test results, provides a balanced strategy that detects infections while limiting medication to cats who actually need it. If your cat is an adult indoor-only cat who has never tested positive for parasites and who has no exposure to outdoor environments or to other cats, annual fecal testing is adequate parasite surveillance, and regular preventive deworming provides minimal additional benefit. Discuss testing-based parasite control with your veterinarian rather than automatically accepting regular deworming recommendations. If your cat goes outdoors, hunts, or lives with other cats who go outdoors, regular deworming every 3 to 6 months is justified by continuous exposure risk and provides protection that testing alone cannot achieve due to the possibility of infections that develop between testing intervals. If you have kittens, follow the recommended aggressive deworming schedule, regardless of fecal testing results, because roundworm prevention in kittens is critical for both kitten health and human health protection. Parasite control is important, but appropriate parasite control is individualized, based on risk factors rather than applied uniformly to all cats. Understand your cat's actual exposure risk, implement parasite control measures that match that risk, and avoid unnecessary medication while ensuring adequate protection. Comparison 4. Flea prevention. Year-round versus seasonal flea infestations are one of the most common and most frustrating parasite problems in cat households, and the transition from having no fleas to having a full-blown infestation can occur with startling speed because of the flea life cycle that allows rapid population growth under favorable conditions. A single flea brought into the home can produce thousands of offspring within weeks, and once an infestation is established in carpets, furniture, and bedding, elimination requires months of persistent treatment and environmental management that is far more expensive and time-consuming than prevention would have been. The question for cat owners is whether to use flea preventive medication year-round to prevent infestations from ever starting, or whether to use prevention seasonally during warm months when flea activity is highest, and to discontinue prevention during cold months when flea populations are suppressed by weather. This comparison examines what the flea life cycle is and how environmental conditions affect flea populations, what year-round and seasonal prevention strategies accomplish, what the risks and cost differences are between approaches, and how to make informed decisions about flea prevention based on climate, housing type, and individual cat risk factors. Let's start with the flea life cycle and why it matters for prevention strategies, because understanding how fleas reproduce and survive clarifies when prevention is necessary and when it might be safely discontinued. The cat flea, Catenocephalides felis, is the flea species that infests both cats and dogs despite its name, and it is the flea species responsible for the vast majority of flea problems in households. Adult fleas live on the cat or dog host, feeding on blood multiple times daily and mating continuously. Female fleas begin producing eggs within 24 to 48 hours after their first blood meal, and a single female flea produces 40 to 50 eggs per day throughout her lifespan of several weeks to several months depending on conditions. The eggs do not stick to the host, but fall off into the environment, accumulating in carpets, bedding, furniture, and anywhere the cat spends time. The eggs hatch into larvae within 2 to 12 days, depending on temperature and humidity, and the larvae feed on organic debris, including flea feces, which contain partially digested blood. The larvae develop through 3 stages over 1 to 2 weeks, then spin cocoons and enter the pupal stage. The pupal stage is where the flea life cycle becomes particularly problematic for control efforts. Pupae are protected by the cocoon and are resistant to insecticides, meaning they cannot be killed by environmental treatment. Pupae can remain dormant in the cocoon for weeks to months, waiting for environmental cues including vibration, carbon dioxide, and warmth that indicate a host is present. When a host is detected, the adult flea emerges from the cocoon and immediately seeks the host to begin feeding. The entire life cycle from egg to adult can complete in as little as 2 to 3 weeks under optimal conditions of warmth and humidity, or it can extend to several months under poor conditions or when pupae remain dormant. This variability means that flea populations can explode rapidly when conditions are favorable, and it also means that environmental reservoirs of pupae can persist for months, even when active adult fleas are not visible. The environmental conditions that favor flea development are temperatures above 65 degrees Fahrenheit and relative humidity above 50%. These conditions are present year-round in warm climates and in heated homes in cold climates, which is why fleas can complete their life cycle indoors, even when outdoor temperatures would suppress flea activity. The assumption that winter kills fleas and eliminates the need for prevention is only partially true, because while outdoor flea populations may decline or become inactive in freezing weather, indoor populations in heated homes can continue reproducing throughout the winter. Now let's talk about year-round flea prevention and what it accomplishes. Year-round flea prevention means administering topical or oral flea preventive medication every month throughout the year, without seasonal breaks. The medications kill adult fleas before they can reproduce, preventing egg production and breaking the flea life cycle before environmental contamination occurs. Different flea preventives work through different mechanisms, with some killing adult fleas within hours of administration and others requiring up to 24 hours for full efficacy. But all effective products prevent successful flea reproduction when used consistently. The prevention of infestation establishment is the primary advantage of year-round prevention. If every flea that lands on the cat is killed before it can lay eggs, no environmental contamination occurs, and no infestation can develop. This means the cat never experiences the discomfort of flea bites, never develops flea allergy dermatitis from flea saliva exposure, and the owner never faces the expense and effort of environmental treatment to eliminate an established infestation. The simplicity of year-round prevention is significant from a compliance perspective. When prevention is given every month without interruption, it becomes routine, and the risk of forgetting doses is minimized. Seasonal prevention requires remembering to restart treatment at the appropriate time each year, and delayed restart allows a window where flea exposure can occur unprotected. The protection during unexpected warm spells in cold climates is another advantage. In regions where seasonal prevention seems logical, because winter temperatures typically suppress flea activity, unseasonably warm periods can create windows where fleas become active, but where the cat is not receiving prevention because the owner has discontinued it for the winter. Year-round prevention eliminates this risk. The cost of year-round prevention is the primary disadvantage and is the main reason many owners choose seasonal prevention instead. Flea preventive medications cost $15 to $30 per dose, depending on the product and the cat's weight, which translates to $180 to $360 annually for year-round prevention. For households with multiple cats, the annual cost of year-round prevention for all cats can be substantial. Now let's talk about seasonal flea prevention and when it is appropriate. Seasonal flea prevention means administering flea preventive medication only during months when flea activity is expected, based on climate and temperature, and discontinuing prevention during cold months, when outdoor temperatures suppress flea populations, and when the risk of new flea introduction is minimal. The typical seasonal prevention schedule in cold climates runs from April through November, though the exact months vary by region. The cost savings from seasonal prevention compared to year-round prevention is approximately 30 to 40%, representing 4 to 5 months of medication cost avoided annually. For multiple cat households, the savings can be significant and may make the difference between using prescription preventives versus attempting to manage fleas with less effective over-the-counter products or with no prevention at all. The adequate protection during high-risk months is the assumption behind seasonal prevention. If fleas are not active during winter months, and if the cat has no exposure to environments where fleas might be present, then prevention during those months provides no additional benefit beyond what seasonal prevention already accomplishes during active months. The limitations and risks of seasonal prevention include the risk of mistiming the start or end of prevention, allowing exposure during shoulder seasons, when flea activity may be present earlier or later than expected. The risk of indoor flea populations persisting year-round in heated homes is also relevant, because discontinuing prevention in winter does not eliminate fleas that are already living in the home environment and cycling through their life cycle at indoor temperatures. The Restart Reminder Challenge is practical and real. Many owners who use seasonal prevention intend to restart in spring, but forget or delay, creating an unprotected window where flea exposure can lead to infestation. Unlike year-round prevention where missed doses are rare, because the routine is continuous, seasonal prevention requires remembering to reinitiate treatment after months of not administering medication. Let's examine the specific factors that determine whether year-round or seasonal prevention is appropriate for individual cats. Year-round prevention is appropriate for cats in warm climates where outdoor temperatures remain above 65 degrees year-round and where fleas are active continuously. Cats who have experienced flea infestations previously, indicating that environmental conditions support flea survival year-round cats with flea allergy dermatitis who develop severe skin reactions from even single flea bites. Multi-cat households where the complexity of managing prevention for multiple cats makes year-round routine preferable to seasonal timing. Indoor-outdoor cats who have continuous exposure risk. Regardless of seasonal prevention is appropriate for cats in cold climates with harsh winters, where outdoor temperatures regularly drop below freezing for extended periods. Strictly indoor-only cats with no exposure to outdoor environments or to other animals who might introduce fleas. Households where cost is a significant constraint and where the savings from seasonal prevention determines whether prevention is used at all. Cats who have never had fleas and who live in environments where indoor temperature and humidity do not support year-round flea development. The climate zone consideration is fundamental. The United States can be divided roughly into year-round flea risk zones, including the southern states and coastal California, and seasonal flea risk zones, including the northern states with cold winters. The dividing line is not precise and varies by microclimate, but the general principle is that areas where winter temperatures consistently drop below freezing for weeks to months have genuine seasonal suppression of outdoor flea populations, while areas with mild winters have year-round flea activity. The housing type affects indoor flea survival. Homes with central heating maintain temperatures that support flea development year-round, which means indoor flea populations can persist, even when outdoor temperatures would kill fleas. Homes without central heating, or homes where indoor temperatures drop significantly in winter, provide less favorable conditions for flea survival and may have genuine seasonal reduction in indoor flea populations. The exposure risk assessment includes considering whether the cat goes outdoors, whether other pets in the household go outdoors and could introduce fleas, whether the home is visited by other animals, and whether the cat visits boarding facilities, grooming facilities, or veterinary clinics where flea exposure could occur. Cats with zero exposure risk have minimal need for prevention during low-risk seasons, while cats with any exposure risk benefit from continuous protection. The flea allergy dermatitis consideration is critical for affected cats. Cats with flea allergy develop intense itching and skin lesions from exposure to even single flea bites. And for these cats, preventing all flea exposure is essential for quality of life and skin health. Seasonal prevention creates windows where flea bites can occur, causing disease flares that require veterinary treatment. Year-round prevention is strongly preferred for flea-allergic cats regardless of climate. The environmental treatment requirement when infestations occur makes prevention economics more complex than simply comparing medication cost. Treating an established flea infestation requires months of environmental treatment with premise sprays or foggers, repeated treatments as new fleas emerge from pupae, and often professional pest control services costing hundreds of dollars. The total cost of managing an infestation often exceeds the annual cost of year-round prevention, making prevention the more cost-effective choice even when medication cost seems high. The verdict: year-round flea prevention is the safest and most effective approach for most cats, and is strongly recommended for cats in warm climates, cats with any outdoor exposure, cats with flea allergy dermatitis, and cats in households that have experienced flea infestations previously. Seasonal flea prevention is a reasonable cost-saving option for strictly indoor-only cats in cold climates, with harsh winters where outdoor flea populations are genuinely suppressed for months, and where indoor environmental conditions do not support year-round flea survival. The risk-benefit calculation for individual cats should consider climate, housing type, exposure risk, flea allergy status, and the economic impact of infestation treatment if prevention fails. For most cats in most situations, the risk of infestation and the cost of treatment when it occurs justify year-round prevention despite the higher medication cost. If you are currently using seasonal prevention and your cat has never had fleas, your approach may be adequate for your specific situation. However, if your cat has experienced flea infestations during months when you were not using prevention, switch to year-round prevention to eliminate the exposure windows that allow infestations to establish. If cost is preventing you from using year-round prescription flea prevention, discuss options with your veterinarian, including less expensive preventive products that still provide effective protection. Do not switch to over-the-counter flea products without veterinary guidance, as many of these products are ineffective or unsafe for cats. Fleas are preventable. Infestations are miserable for cats and expensive for owners. Choose the prevention strategy that matches your cat's risk factors, implement it consistently, and protect your cat from a parasite problem that should never occur with appropriate preventive care. Comparison 5. Blood work, annual versus twice yearly. For all ages, diagnostic blood work is one of the most valuable tools in preventive veterinary medicine because it detects disease processes before clinical symptoms appear, allowing early intervention that can slow disease progression, prevent complications, and extend both lifespan and quality of life. The standard recommendation for healthy adult cats has traditionally been annual blood work as part of wellness examinations, operating under the assumption that yearly screening provides adequate disease surveillance while minimizing cost and the stress of veterinary visits. But the recognition that many feline diseases progress rapidly and that early detection dramatically improves outcomes has led some veterinary practices to recommend twice-yearly blood work for all adult cats, not just for seniors. And the question for cat owners is whether the additional cost and clinic visits required for twice-yearly testing provide meaningful benefit over annual testing, or whether annual screening is adequate for healthy cats without specific risk factors. This comparison examines what blood work detects and how early detection affects treatment outcomes, what the progression timeline is for common feline diseases, and whether annual testing provides adequate surveillance, what the cost-benefit calculation is for twice-yearly versus annual testing, and how to make informed decisions about screening frequency based on your cat's age, health status, and individual risk factors. Let's start with what blood work actually measures and why it provides information that physical examination alone cannot detect. A complete blood count, or CBC, measures red blood cells, white blood cells, and platelets, providing information about anemia, infection, inflammation, immune system function, and blood clotting capability. Abnormalities in the CBC can indicate conditions ranging from parasites, causing blood loss anemia, to leukemia causing abnormal white blood cell counts, to immune-mediated diseases causing platelet destruction. A chemistry panel, also called a biochemistry profile, measures organ function markers including kidney values, such as creatinine and blood urea nitrogen, liver enzymes such as ALT and ALP, blood sugar, electrolytes, and proteins. The chemistry panel detects kidney disease, liver disease, diabetes, electrolyte imbalances, and protein abnormalities that indicate various disease processes. A thyroid panel measures thyroid hormone levels, typically total T4, and detects hyperthyroidism, the excessive thyroid hormone production that is extremely common in senior cats, and that causes weight loss, increased appetite, hyperactivity, vomiting, diarrhea, and if untreated, heart disease and death. The value of blood work is that it detects disease at stages where no clinical symptoms are apparent. A cat with early chronic kidney disease may have normal behavior, normal appetite, normal urination, and normal physical examination, findings, but blood work reveals elevated kidney values that indicate kidney function is declining. Early detection at this stage allows dietary intervention, medication to support kidney function, and close monitoring that can slow disease progression and extend the time before the cat develops clinical kidney failure. Now, let's examine the specific diseases where early detection through blood work provides meaningful treatment benefit, because understanding what is being screened for clarifies the value of more frequent testing. Chronic kidney disease is one of the most common diseases in cats and is the leading cause of death in senior cats. CKD is progressive and irreversible, meaning kidney function declines over time and does not recover. However, the rate of decline can be slowed dramatically through early intervention, including prescription kidney diets, phosphate binders, blood pressure management, and hydration support. The challenge is that cats do not show clinical symptoms of kidney disease until 75% of kidney function is lost, which means by the time the cat is drinking excessively and urinating frequently, the disease is already advanced. Blood work detects kidney disease at much earlier stages by measuring creatinine and BUN, which begin to rise when kidney function has declined to approximately 60 to 70% of normal capacity. This provides a window of opportunity where intervention can slow progression before the cat reaches the crisis stage, where kidney disease becomes life-threatening. The progression rate of CKD varies enormously between individual cats, with some progressing slowly over years and others progressing rapidly over months. For rapidly progressing cases, annual blood work may not catch the disease early enough to maximize the benefit of intervention. Hyperthyroidism develops in approximately 10% of cats over 10 years of age and in up to 20% of cats over 12 years of age. The disease causes overproduction of thyroid hormone that increases metabolic rate, causing weight loss despite increased appetite, hyperactivity, vomiting, diarrhea, and secondary heart disease from the cardiovascular stress of chronically elevated heart rate and blood pressure. Hyperthyroidism is treatable through medication, radioactive iodine therapy, or surgical removal of the thyroid gland, and early treatment prevents the development of heart disease that becomes irreversible once established. The progression from normal thyroid function to clinical hyperthyroidism can occur within months in some cats, and the initial stages where thyroid hormone is mildly elevated may not cause obvious symptoms. Annual screening may miss the window where treatment could prevent heart changes, while twice-yearly screening provides earlier detection and intervention. Diabetes mellitus develops when the pancreas stops producing adequate insulin or when cells become resistant to insulin, causing elevated blood sugar that damages organs and causes increased thirst, increased urination, increased appetite with weight loss, and eventually diabetic ketoacidosis, a life-threatening complication. Diabetes in cats is sometimes reversible if caught early and treated aggressively with insulin and dietary changes. But diabetes that has been present for months before diagnosis is less likely to achieve remission. Blood work detects diabetes by measuring blood glucose, and early detection, when blood sugar is mildly elevated, allows dietary intervention and close monitoring before insulin treatment becomes necessary. Some cats caught at the pre-diabetic stage can be managed with diet alone and never progress to requiring insulin. Annual screening may not detect diabetes until it is established enough that insulin is required, while twice-yearly screening catches more cases in the pre-diabetic or early diabetic stage where remission is possible. Liver disease in cats includes conditions ranging from fatty liver disease caused by rapid weight loss to inflammatory liver disease to liver cancer. Early liver disease often causes only subtle increases in liver enzymes on blood work without causing obvious symptoms. And early detection allows diagnosis through further testing and treatment before the liver is severely damaged. Anemia from various causes, including parasites, immune-mediated hemolytic anemia, and bone marrow disease is detected through CBC. And early detection allows treatment before the anemia becomes severe enough to cause weakness, collapse, or death. Now, let's talk about the specific age considerations for screening frequency, because age affects disease risk and screening recommendations. Young adult cats, 1 to 7 years, have relatively low disease risk compared to senior cats, and annual blood work is generally adequate screening for this age group. Establishing baseline blood work values while the cat is young and healthy provides comparison points for future testing and allows detection of congenital or early onset diseases that may not be obvious on physical examination. Mature adult cats, 7 to 10 years, are entering the age range where disease prevalence begins to increase, and twice-yearly screening begins to provide more value than annual screening, because diseases including early kidney disease, hyperthyroidism, and diabetes begin appearing in this age group with increasing frequency. Senior cats, 10+ years, have high disease prevalence, and twice-yearly screening is strongly recommended because the diseases common in this age group progress rapidly enough that annual screening may not provide adequate surveillance. We address this in Part 3 of this series, and the recommendation for seniors is clear: twice yearly is necessary. Geriatric cats, 15+ years, benefit from even more frequent monitoring in some cases, with blood work every 4 to 6 months if disease is detected and being managed. Though for healthy geriatric cats without detected disease, twice yearly remains adequate. The question this comparison addresses is whether twice yearly screening should be extended to younger adults in addition to seniors. And the answer depends on weighing early detection benefit against cost and logistics. Let's examine the cost-benefit calculation for annual versus twice-yearly testing. Annual blood work cost for a standard wellness panel, including CBC, chemistry, and thyroid testing, typically ranges from $150 to $300 depending on geographic location and clinic pricing. This is a once-yearly expense that most cat owners budget for as part of routine preventive care. Twice-yearly blood work cost doubles this expense to $300 to $600 annually, which is a significant increase that affects household budgets and that may influence whether owners pursue testing at all. For multi-cat households, the cost of twice-yearly testing for all cats can be prohibitive. The early detection value calculation requires estimating how often twice-yearly testing catches disease that annual testing would miss, and how much treatment benefit early detection provides. The data suggests that for cats under 7 years of age, the incremental detection rate from twice-yearly versus annual testing is low because disease prevalence is low in young cats. For cats over 10 years of age, the incremental detection rate is high because disease prevalence and progression rates are high in seniors. For cats in the 7 to 10-year age range, which is the transition zone where disease risk is increasing, but is not yet as high as in seniors, the value of twice-yearly testing depends on individual risk factors, including breed predispositions to specific diseases, previous health history, and owners' ability to monitor for subtle symptoms between vet visits. The quality of life and lifespan extension from early detection is real but difficult to quantify. Precisely. A cat whose hyperthyroidism is detected at thyroid hormone level of 4 versus a cat whose hyperthyroidism is detected at level of 8 may experience months to years of additional healthy lifespan because early treatment prevents heart damage. The exact benefit varies by individual, but the principle that earlier is better is well established. The stress and logistics consideration affects some cats significantly. Cats who experience severe stress from veterinary visits may experience more harm from twice-yearly visits than benefit from the additional screening, particularly if the cat is young and healthy with low disease risk. For these cats, annual visits with blood work may provide better overall welfare than twice-yearly visits that cause profound stress. The at-home blood draw option is becoming available through some mobile veterinary services and through at-home blood collection kits, where the owner collects a small blood sample and ships it to a laboratory for analysis. This option reduces clinic visit stress while maintaining screening frequency, though it does not replace the value of physical examination by a veterinarian. The verdict, twice-yearly blood work provides meaningful early detection benefit for mature adult cats, 7 to 10 years, and is essential for senior cats, 10 plus years, as discussed in Part 3. The increased screening frequency catches diseases during windows, where early intervention provides maximum treatment benefit. Annual blood work is adequate screening for young adult cats, 1 to 7 years, without specific risk factors or health history that would justify more frequent testing. The disease prevalence in this age group is low enough that the incremental benefit of twice-yearly screening does not justify the doubled cost for most cats. Individual risk factors including breed predispositions, previous health issues, lifestyle factors like obesity that increase diabetes risk, and family history of heritable diseases may justify twice-yearly screening even in younger cats when specific risk is identified. The ideal approach is age-stratified screening frequency. Annual blood work for cats under 7 years old, transition to twice yearly at age 7, and maintain twice yearly for life after age 10. This provides appropriate disease surveillance throughout the lifespan while managing cost and minimizing unnecessary stress for young, healthy cats. If your cat is between 7 and 10 years old and you are currently doing annual blood work only, discuss transitioning to twice-yearly screening with your veterinarian. The diseases that develop during this age range progress rapidly enough that earlier detection can meaningfully improve outcomes. If your cat is over 10 and you are still doing annual blood work, you are missing critical disease detection windows. Transition to twice yearly immediately, as this is not optional for senior cat care. If cost is preventing twice yearly screening for your senior cat, discuss payment options with your clinic, including wellness plans that spread the cost over monthly payments, or investigate lower cost options, including blood work through veterinary schools or low-cost clinics that provide screening at reduced rates. Blood work is not expensive compared to the cost of treating advanced disease that was not caught early. Early kidney disease managed with diet costs hundreds of dollars over years. Late-stage kidney failure requiring hospitalization, fluid therapy, and intensive treatment costs thousands of dollars and provides less benefit. Early detection saves money and saves lives. Invest in appropriate screening, catch disease when it is treatable, and give your cat the best chance at a long, healthy life. Comparison. 6. Microchip versus tattoo identification. The loss of a cat is one of the most distressing experiences a cat owner can face, and the outcome when a lost cat is found by a stranger or brought to a shelter depends almost entirely on whether the cat has permanent identification that allows reuniting with the owner. Collars with ID tags are the most visible form of identification, but are unreliable because collars can slip off, break, or be removed, leaving the cat with no identification when found. Permanent identification through either microchipping or tattooing provides identification that cannot be lost or removed and that remains with the cat for life, dramatically increasing the likelihood of successful reunion if the cat becomes lost. The two primary permanent identification methods are microchipping, where a tiny electronic chip encoded with a unique identification number is injected under the skin, and tattooing, where a permanent mark is applied to the skin, typically inside the ear or on the inner thigh. Both methods have been used successfully for decades, but microchipping has become the dominant method in most regions, while tattooing has declined to specialized use in specific contexts. This comparison examines what each identification method provides, what the advantages and limitations of each are, how effective they are at facilitating lost cat return, and how to make informed decisions about permanent identification for your cat. Let's start with microchipping and how it works, because understanding the technology clarifies both its capabilities and its limitations. A microchip is a tiny electronic device, approximately the size of a grain of rice, that contains a unique identification number programmed into the chip at manufacture. The chip is encased in biocompatible glass and is injected under the skin between the shoulder blades, using a needle slightly larger than a standard vaccination needle. The injection procedure is quick, requires no anesthesia, and causes momentary discomfort similar to a vaccine injection. Once implanted, the microchip remains in place for the cat's lifetime, though it can occasionally migrate from the injection site to other locations under the skin. The microchip contains no battery and has no internal power source. It is a passive device that only activates when scanned by a microchip reader that emits a radio frequency signal. Well, when scanned, the chip absorbs energy from the scanner's signal and uses that energy to transmit its unique identification number back to the scanner, where it is displayed. The chip itself stores only the identification number. It does not store owner contact information, GPS location, or any other data. The identification number from the microchip is registered in a database maintained by the microchip manufacturer or by third-party pet recovery services. The registration links the chip number to the owner's contact information, including name, address, phone number, and email. When a lost cat with a microchip is found and scanned, the identification number is looked up in the database, and the owner's contact information is retrieved, allowing the finder or shelter to contact the owner. The critical requirement for microchip effectiveness is registration. An unregistered microchip provides no identification benefit because the chip number cannot be linked to owner information. Many cats receive microchips at shelters or through veterinary clinics but are never registered by the owner, rendering the chip useless for identification purposes. Studies of lost cats brought to shelters show that a significant percentage of microchipped cats cannot be reunited with owners because the chip was never registered, or because the registration information is outdated after the owner moved or changed phone numbers without updating the database. The universal scanner compatibility issue has been a historical problem with microchipping, but has largely been resolved in recent years. Different microchip manufacturers historically use different radio frequencies, and scanners designed for one frequency could not read chips using a different frequency. This meant that a cat microchipped with a chip using 125 kHz frequency would not be detected by a scanner reading only 134 kHz chips. Universal scanners that read all common microchip frequencies are now standard in shelters and veterinary clinics, largely eliminating this compatibility problem, though some older scanners in use may still have limited frequency capability. The scanning protocol in shelters and veterinary clinics is to scan any found cat for a microchip as part of the intake process. However, scanning is not infallible. Microchips can occasionally fail, can migrate to locations where they are not detected by standard scanning, or can be missed by scanners that are not functioning properly or that are used incorrectly. The reliability of microchip detection depends on proper scanning technique, including scanning the entire body rather than just the standard implantation site between the shoulder blades. Now let's talk about tattooing and how it differs from microchipping as an identification method. Tattoo identification involves applying a permanent mark to the cat's skin, typically using a tattoo machine that injects ink into the dermis layer of skin, where it remains permanently visible. The most common tattoo locations in cats are the inner ear flap and the inner thigh, and the tattoo typically consists of a series of numbers and sometimes letters that serve as the identification code. The visibility of tattoos is both an advantage and a limitation. Unlike microchips, which require a scanner to detect, tattoos are visible to anyone who examines the cat, meaning identification can be confirmed without specialized equipment. This makes tattoos potentially useful in situations where microchip scanners are not available, or where the finder is an individual rather than a shelter or veterinary clinic. However, tattoos on locations like the inner thigh are not readily visible unless someone specifically looks for them, and tattoos can fade over time, become less legible, or be obscured by fur, reducing their visibility and usefulness. The registration requirement for tattoos is similar to microchips in that the tattoo number must be registered in a database that links the number to owner contact information. Various tattoo registries exist, though they are less standardized and less universally used than microchip registries. The lookup process when a tattooed cat is found requires knowing which registry to search, which can be challenging if multiple registries are in use in a region. The application procedure for tattoos requires anesthesia or heavy sedation because the tattooing process is painful and the cat must remain still during application. This means tattooing is typically performed during spay/neuter surgery when the cat is already anesthetized, rather than as a standalone procedure. The need for anesthesia makes tattooing more invasive and more expensive than microchipping, which can be performed in a routine office visit. Without anesthesia, the permanence of tattoos is guaranteed in the sense that the tattoo cannot fall off or be removed, but the legibility can deteriorate over time as ink fades or spreads in the skin. Tattoos applied to young animals may distort as the animal grows, potentially affecting legibility. Dark-colored ink on dark skin can be difficult to read, and infection or scarring at the tattoo site can obscure the mark. The legal implications of tattooing vary by jurisdiction. In some regions, tattoos in the ear are used by shelters and veterinary clinics to indicate that a cat has been spayed or neutered, with specific marks indicating sex and sterilization status. This use of tattooing for surgical status indication is separate from identification tattooing, but uses the same location. And the presence of an ear tattoo may cause confusion about whether it represents identification or surgical status. The current usage of tattooing as primary identification has declined, significantly in regions where microchipping is widely available and accepted. Tattooing remains in use in some breeding registries, where breeders tattoo registration numbers on purebred cats, and in some rural regions where tattoo registries are well established and where microchipping infrastructure is less developed. However, in most urban and suburban areas, microchipping has replaced tattooing as the standard permanent identification method. Let's examine the comparative advantages and limitations of each method to clarify when each is appropriate. Microchip advantages: no anesthesia required, can be performed during routine office visit, less painful than tattooing, similar to vaccine injection, does not fade or become illegible over time, widely recognized and scanned in shelters and veterinary clinics, standardized registries with good database coverage. Microchip limitations: requires scanner to detect, not visible without equipment. Effectiveness depends on registration, and registry information being current can occasionally migrate or fail. Registration fees vary by company, and some charge annual fees. Tattoo advantages: visible identification that does not require scanner, cannot be lost or removed, no electronic components to fail, can be detected by anyone who examines the cat. Tattoo limitations: requires anesthesia for application, more painful and invasive than microchipping, can fade or become illegible over time. Less standardized registry system may be confused with spay/neuter status marks, not as widely recognized or looked for by finders. The combination approach using both microchip and tattoo provides redundancy and maximizes identification reliability, and this approach is used in some contexts, including breeding programs and working cats, where loss risk is high. The combination ensures that if one identification method fails or is overlooked, the other provides backup identification. The specific situations where each method is clearly preferable or where combination is justified, microchipping alone is appropriate for most household cats as standard permanent identification, cats being adopted from shelters where microchipping is standard procedure, cats where the owner prefers non-invasive identification regions, where microchip infrastructure is well established. Tattooing alone is appropriate for purebred cats registered with breed clubs that use tattoo identification regions, where tattoo registries are well established and microchip scanning is uncommon. Situations where visible identification is specifically required. Combination microchip and tattoo is appropriate for high-value breeding cats, cats with high loss risk, including those with outdoor access, cats traveling internationally, where both forms of identification may be required or beneficial. The registration maintenance responsibility is critical, regardless of which identification method is used. The most common failure mode for both microchips and tattoos is outdated registration information that prevents contact with the owner when a lost cat is found. Owners must update registration information when they move, change phone numbers, or change email addresses. And they should verify annually that registration is current and that contact information is correct. The microchip scanning at veterinary visits provides verification that the chip is present and functional. Many veterinary clinics scan for microchips during routine examinations, and owners should request scanning to confirm that the chip is present and can be detected. If the chip cannot be detected, investigation is needed to determine if the chip has failed, migrated, or if the scanner is not functioning properly. The verdict: microchipping is the superior permanent identification method for most cats in most situations, providing reliable identification that does not require anesthesia, that does not fade over time, and that is widely recognized and scanned by shelters and veterinary clinics. Tattooing remains appropriate in specialized contexts, including breed registries, and in regions where tattoo infrastructure is well established, but it has been largely replaced by microchipping in most areas due to the advantages of microchips, including ease of application and standardized registry systems. The combination of microchip and tattoo provides maximum identification reliability for high-value or high-risk cats, but is not necessary for most household cats, where microchipping alone provides adequate permanent identification. If your cat is not microchipped, schedule microchipping at your next veterinary visit. The procedure is quick, relatively inexpensive at $25 to $50 in most clinics, and provides permanent identification that dramatically increases the likelihood of reunion if your cat becomes lost. If your cat is already microchipped, verify that the chip is registered and that the registration information is current. Contact the microchip company or check their website to confirm your contact information is correct, and update it immediately if you have moved or changed phone number since registration. If you are considering tattooing in addition to microchipping for a high-value cat, discuss the procedure and registry options with your veterinarian to ensure that the tattoo will be applied correctly and registered in a database that is accessible to finders. Permanent identification is one of the simplest and most effective tools for protecting your cat against permanent loss. Implement it, maintain it, and ensure that if your cat is ever found by someone else, they can contact you and return your cat home where they belong. Comparison 7. Health insurance, accident only versus comprehensive coverage. Pet health insurance has evolved from a niche product available through only a handful of companies to a mainstream financial planning tool offered by dozens of insurers with coverage options ranging from bare minimum accident protection to comprehensive policies that cover preventive care, chronic disease management, alternative therapies, and end-of-life care. The growth of the pet insurance market reflects both the increasing cost of veterinary medicine as diagnostic and treatment capabilities expand, and the recognition by pet owners that unexpected veterinary expenses can create financial crises that force impossible decisions between treating a beloved pet and maintaining household financial stability. The question for cat owners is not whether to have some form of financial protection against veterinary costs, but what level of coverage provides appropriate protection at a cost that makes sense relative to the actual likelihood and magnitude of expenses that the insurance would cover. This comparison examines what accident-only and comprehensive insurance policies cover, and what they exclude, what the cost difference is, and how to evaluate whether comprehensive coverage provides value proportional to its higher premiums, what the claim process and reimbursement structures are, and how they affect out-of-pocket costs, and how to make informed decisions about insurance coverage based on your cat's age, health status, and your financial capacity to handle unexpected veterinary expenses. Let's start with what accident-only insurance covers and what situations it protects against, because understanding the scope of coverage clarifies whether it provides adequate protection or whether gaps exist that would leave you financially exposed. accident-only insurance covers injuries resulting from accidents, including falls, vehicle strikes, bites from other animals, ingestion of foreign objects, lacerations, fractures, and other trauma-related injuries. The coverage typically includes diagnostic testing to evaluate the injuries such as X-rays and blood work, emergency treatment, including surgery if needed, hospitalization, and follow-up care related to the accident. For example, if your cat falls from a window and fractures a leg, accident-only insurance would cover the emergency examination, X-rays to diagnose the fracture, orthopedic surgery to repair the fracture, pain medication, and follow-up examinations during healing. The exclusions from accident-only coverage are extensive and include all illness-related conditions, regardless of how serious or expensive they are. Accident-only policies do not cover cancer, kidney disease, diabetes, hyperthyroidism, urinary blockages, respiratory infections, gastrointestinal disease, dental disease, or any other condition that is not directly caused by an identifiable accident. This means the most common and most expensive conditions that affect cats are not covered by accident-only insurance, leaving the owner fully financially responsible for illness-related veterinary care. The cost of accident-only insurance is significantly lower than comprehensive coverage, typically ranging from $10 to $20 per month depending on the cat's age and the policy deductible and reimbursement percentage. The low premium makes accident-only coverage affordable for owners with tight budgets who want some financial protection but who cannot afford comprehensive coverage. And it provides value if major accidents occur, though the likelihood of major accident versus major illness must be considered when evaluating whether accident-only coverage is adequate. The claim frequency for accident-only policies is low because most cats do not experience major accidents requiring expensive veterinary care. Indoor-only cats have minimal accident risk compared to outdoor cats who face traffic, attacks from other animals, and various environmental hazards. An indoor cat who never goes outside and who lives in a home without high balconies or windows has very low probability of experiencing an accident that would generate an insurance claim, meaning the owner pays premiums year after year without ever receiving reimbursement for expenses. Now let's talk about comprehensive insurance and what distinguishes it from accident-only coverage in terms of what it covers and what protection it provides. Comprehensive pet insurance, also called accident and illness coverage, covers both injuries from accidents and illnesses of all types, including chronic diseases, acute conditions, hereditary conditions, and congenital conditions depending on the specific policy terms. Comprehensive policies cover the diagnostic testing, treatment, hospitalization, surgery, and medication needed to address covered conditions, and they typically provide coverage for the full range of conditions that commonly affect cats, including the expensive chronic diseases that drive the highest veterinary costs. The chronic disease coverage is the primary value proposition of comprehensive insurance and is what accident-only policies completely lack. A cat who develops chronic kidney disease will require dietary management, medications, subcutaneous fluid therapy, and regular monitoring blood work for the rest of their life, with cumulative costs that can reach thousands of dollars annually. A cat who develops diabetes requires insulin injections twice daily, blood glucose monitoring, and regular veterinary visits, with costs of $1,000 to $2,000 annually. A cat who develops cancer may require surgery, chemotherapy, and intensive supportive care costing $5,000 to $15,000, depending on cancer type and treatment aggressiveness. Comprehensive insurance covers these conditions, subject to deductibles, co-insurance, and annual limits, providing financial support that makes treatment affordable when it would otherwise be prohibitively expensive. The pre-existing condition exclusion is the most significant limitation of comprehensive insurance and is universal across all pet insurance companies. Conditions that existed before the insurance policy began or during waiting periods are permanently excluded from coverage, meaning if your cat has diabetes when you purchase insurance, the diabetes and all related treatment will never be covered. This pre-existing condition exclusion creates strong incentive to purchase insurance while cats are young and healthy, because waiting until disease develops means the disease will be excluded and the primary value of insurance will be lost. The waiting period before coverage begins is standard in comprehensive policies and typically ranges from 14 to 30 days for illness coverage, with shorter or no waiting periods for accident coverage. The waiting period prevents owners from purchasing insurance after noticing symptoms and then immediately filing claims, which would undermine the insurance model. During the waiting period, any conditions that develop or that are diagnosed are considered pre-existing and are permanently excluded from coverage. The annual limit, deductible, and reimbursement percentage structure determines how much the insurance actually pays when claims occur. Let's break down these components because they are critical to understanding the true financial protection the policy provides. The annual limit is the maximum amount the insurance will pay in claims during each policy year. Annual limits range from $5,000 to unlimited depending on the policy, with higher annual limits corresponding to higher premiums. For most cats, a $10,000 to $15,000 annual limit provides adequate coverage because veterinary expenses rarely exceed this amount in a single year, except in cases of catastrophic illness requiring intensive treatment. Unlimited annual limit policies provide maximum protection, but cost significantly more and may not provide proportional value for most owners. The deductible is the amount the owner must pay out of pocket before the insurance begins reimbursing expenses. Deductibles can be structured as annual deductibles where the owner pays the deductible amount once per year and all claims after that are reimbursed, or as per-incident deductibles, where the deductible applies separately to each new condition. Annual deductibles are more favorable to policyholders because they limit out-of-pocket costs more effectively than per-incident deductibles. Deductible amounts typically range from $100 to $1,000, with higher deductibles resulting in lower premiums. The reimbursement percentage is the percentage of eligible expenses that the insurance pays after the deductible has been met. Common reimbursement percentages are 70, 80, or 90%, with higher reimbursement percentages corresponding to higher premiums. A policy with 90% reimbursement and a $250 annual deductible would work as follows. If your cat incurs $5,000 in covered veterinary expenses in a year, you pay the first $250 as the deductible. Then the insurance reimburses 90% of the remaining $4,750, which equals $4,275. Your total out-of-pocket cost would be $725 instead of $5,000. The claim reimbursement process requires the owner to pay the veterinary bill in full at the time of service, then submit a claim to the insurance company with invoices and medical records, and receive reimbursement weeks to months later after the claim is processed. This means pet insurance is a reimbursement model rather than a direct payment model, and owners must have the financial capacity to pay large veterinary bills up front and wait for reimbursement rather than having the insurance pay the veterinarian directly. The wellness coverage option is offered by some comprehensive policies as an add-on that covers routine preventive care, including vaccinations, annual examinations, blood work, fecal, testing, and dental cleanings. Wellness coverage increases premiums and typically has relatively low annual limits for covered preventive care, often in the range of $250 to $500 annually. The value proposition of wellness coverage is questionable because the premium increase often equals or exceeds the amount the policy would reimburse for routine care, meaning you are essentially prepaying for predictable expenses through insurance rather than budgeting for them directly. Let's examine the cost-benefit calculation for accident-only versus comprehensive coverage and how to determine which provides better value for your situation. Accident-only insurance costs of $10 to $20 per month over a cat's lifetime from 1 year to 15 years equals approximately $1,800 to $3,600 in total premiums paid. If no major accidents occur during the cat's life, the owner receives zero reimbursement and has paid premiums for coverage that was never used. If a major accident occurs costing $3,000 to $5,000, the insurance provides value by reimbursing most of the cost after deductible and co-insurance. Comprehensive insurance costs of $30 to $80 per month depending on coverage level, and the cat's age equals approximately $5,400 to $14,400 in total premiums over a cat's lifetime. The higher premium reflects the broader coverage and the higher likelihood that claims will be filed because illness is more common than major accidents. The break-even analysis asks how much in veterinary expenses must occur for the insurance to provide value greater than the total premiums paid. For accident-only insurance with low premiums, break-even occurs with a single major accident. For comprehensive insurance with higher premiums, break-even occurs if the cat develops chronic illness requiring ongoing treatment, experiences a major acute illness requiring expensive intervention, or requires multiple moderate illnesses over their lifetime. The probability assessment requires estimating the likelihood that your cat will experience veterinary expenses exceeding what you would pay in premiums. The data suggests that most cats will experience at least one major illness during their lifetime, and many cats will develop chronic diseases in their senior years that generate ongoing expenses for years. This means the probability of comprehensive insurance providing value is relatively high, particularly if the policy is maintained into the cat's senior years, when disease prevalence is highest. The alternative to insurance is self-funding emergency veterinary expenses through savings, and the discipline to maintain adequate savings is the critical factor that determines whether self-funding is viable. Setting aside the monthly amount that would go to insurance premiums into a dedicated emergency fund builds a reserve that can be used for veterinary expenses. And unlike insurance premiums, which disappear if never used, savings remain available for other purposes if the cat never requires expensive care. However, most owners lack the discipline to maintain pet emergency savings and will spend the money on other expenses if it is not committed to insurance premiums. The verdict: comprehensive insurance provides superior financial protection for most cat owners compared to accident-only coverage, particularly if the policy is purchased while the cat is young and healthy before pre-existing conditions develop. The coverage of chronic illness, which is the primary driver of high veterinary costs, provides value that accident-only coverage cannot deliver. Accident-only insurance is a minimal protection option that may be appropriate for owners with severe budget constraints who cannot afford comprehensive coverage, but who want some protection against catastrophic accident expenses. However, the gaps in coverage are extensive and leave the owner financially exposed to the most common and most expensive conditions that affect cats. The decision to purchase insurance versus self-funding depends on financial discipline and capacity. If you have the discipline to maintain a dedicated pet emergency fund of $5,000 to $10,000 and can afford to pay unexpected veterinary expenses from that fund without financial hardship, self-funding is a reasonable alternative to insurance. If you lack that discipline or that financial capacity, comprehensive insurance transfers the financial risk and ensures that treatment decisions are not limited by inability to pay. If you choose to purchase insurance, do so while your cat is young, before pre-existing conditions develop. Research policies carefully, understand exclusions and coverage limits, and choose policies with favorable terms including annual deductibles rather than per-incident deductibles and high reimbursement percentages of 80 to 90%. If you choose to self-fund, commit to building and maintaining an emergency fund sufficient to cover major veterinary expenses, and do not allow yourself to spend that fund on non-emergency purposes. Financial protection against veterinary expenses is not optional. The question is whether you achieve that protection through insurance premiums or through savings discipline. Choose the approach that matches your financial situation and your behavioral capacity to maintain discipline, and ensure that when your cat needs expensive veterinary care, finances are not the barrier to providing treatment. Comparison 8. Heartworm prevention. Necessary versus regional heartworm disease is a serious and potentially fatal parasitic infection caused by the worm Deworming immitis, which is transmitted through mosquito bites and which develops into adult worms that live in the heart and pulmonary arteries, causing progressive heart and lung damage that leads to heart failure and death if untreated. Heartworm is well known as a significant health threat to dogs, and heartworm prevention is considered essential routine care for dogs in most regions of the United States and in many other countries. What is less widely understood is that cats are also susceptible to heartworm infection. And while the disease manifests differently in cats than in dogs, and while prevalence is lower, the consequences when infection occurs are severe, and treatment options are extremely limited, making prevention the only effective strategy for protecting cats from this parasite. The question for cat owners is whether heartworm prevention is necessary for all cats, regardless of geographic location, or whether prevention can be limited to cats in regions where heartworm transmission is endemic and where mosquito populations are high, with cats in low prevalence regions being managed without prevention. This comparison examines what heartworm disease is in cats and how it differs from canine heartworm, what the geographic distribution of heartworm is, and what factors affect transmission risk, what prevention options exist, and how they work, and how to make informed decisions about heartworm prevention based on your location, your cat's indoor-outdoor status, and the local prevalence of heartworm infection. Let's start with what heartworm disease is in cats and why it poses different challenges than heartworm in dogs, because understanding the feline-specific aspects of the disease clarifies why prevention strategies that work for dogs are not directly transferable to cats. Heartworm infection in cats begins when a mosquito-carrying heartworm larvae bites a cat and transmits the microscopic larvae into the cat's bloodstream. The larvae migrate through tissues and develop through several stages over approximately 6 months, eventually reaching the heart and pulmonary arteries, where they attempt to mature into adult worms. In dogs, heartworm infections typically result in large numbers of adult worms establishing in the heart and living for years, causing progressive disease that is chronic and treatable with medications that kill the adult worms. In cats, heartworm behaves very differently. Cats are not natural hosts for heartworm, and their immune systems mount aggressive responses against the developing larvae and adult worms. This immune response kills most larvae before they reach adulthood, which means cats typically have far fewer adult worms than dogs, often only 1 to 3 worms compared to dozens in infected dogs. However, this immune response itself causes significant disease through inflammation in the lungs and blood vessels, and the sudden death of even a single adult worm can trigger acute respiratory crisis or sudden death in cats. This means that even low-level infections that might be considered minor in dogs can be life-threatening in cats. The clinical signs of heartworm disease in cats are often nonspecific and include coughing, difficulty breathing, vomiting, lethargy, and decreased appetite. These signs are easily confused with other respiratory diseases, including asthma and bronchitis, and many cats with heartworm are misdiagnosed with these other conditions and treated inappropriately. Some cats experience sudden death as the first and only sign of heartworm infection, with no prior symptoms to indicate that disease was present. The diagnostic challenge in cats is that heartworm testing is less sensitive and less reliable than in dogs. The standard heartworm test used in dogs detects antigens produced by adult female worms. But because cats typically have very few adult worms and often have only male worms or immature worms, the antigen test frequently produces false negative results in infected cats. Additional testing, including antibody tests and chest X-rays, improves diagnostic accuracy. But even with comprehensive testing, some heartworm infections in cats are never definitively diagnosed. The treatment limitation is the most critical difference between heartworm in cats and dogs. In dogs, heartworm infection is treated with melarsoline, a medication that kills adult heartworms. allowing the dog to recover after the worms are eliminated and their bodies are cleared from the circulation. In cats, melarsoline is not approved and is not safe because the sudden death of adult worms triggers severe inflammatory reactions that can cause fatal respiratory crisis. There is no approved treatment for eliminating adult heartworms in cats, which means treatment is limited to supportive care to manage symptoms while waiting for the worms to die naturally over their 2 to 3 year lifespan. Many cats do not survive heartworm infection despite supportive care. Now let's examine the geographic distribution of heartworm and what regions have high versus low transmission risk. Heartworm is endemic throughout the United States, but prevalence varies dramatically by region. The highest prevalence occurs in the southeastern United States, including the Gulf Coast states, the Mississippi River Valley, and the Atlantic coastal states, where warm, humid climates support large mosquito populations and year-round mosquito activity. In these high-prevalence regions, heartworm infection rates in unprotected dogs can reach 30 to 45%, and while infection rates in cats are lower, they are still significant enough that prevention is clearly justified. The lowest prevalence occurs in arid regions, including the desert Southwest, in high-altitude regions where mosquito populations are low, and in northern regions with short mosquito seasons. However, heartworm has been documented in all 50 states, and the geographic range is expanding as climate change extends mosquito breeding seasons and as infected animals travel between regions, transporting heartworm to areas where it was previously rare. The mosquito species that transmit heartworm are common mosquitoes, including Aedes, Anopheles, and Culex species that are found in most regions, and that breed in standing water, including ponds, drainage ditches, bird baths, and containers around homes. The presence of mosquitoes does not guarantee heartworm transmission because the mosquitoes must first feed on an infected dog or other host to acquire the larvae before they can transmit it to cats. But in regions where heartworm is endemic in dog populations, the probability that mosquitoes are carrying heartworm is substantial. The indoor cat fallacy is the mistaken belief that indoor-only cats are not at risk for heartworm because they are not exposed to outdoor mosquitoes. The reality is that mosquitoes enter homes regularly through open doors, windows, and gaps in screens, and studies of indoor cats with heartworm infection confirm that indoor-only status does not eliminate risk. The risk for indoor cats is lower than for outdoor cats, but it is not zero, and in these high-prevalence regions, even indoor cats benefit from heartworm prevention. Now let's talk about heartworm prevention options for cats and how they work. Heartworm prevention in cats uses monthly medications that kill heartworm larvae before they develop into adult worms. The medications are macrocyclic lactones, including ivermectin, selamectin, and moxidectin, which are administered either as topical solutions applied to the skin or as oral tablets. The preventive medications do not kill adult heartworms, but prevent larvae from developing, which means they must be given continuously to provide protection. The topical prevention products, including Revolution, selamectin, and Revolution Plus, selamectin plus cerulanair, are applied monthly to the skin at the base of the neck and provide heartworm prevention along with flea control and protection against some intestinal parasites. The combination coverage makes topical products convenient for owners who want comprehensive parasite protection in a single product. The oral prevention products are less common in cats than topical products, but are available and provide heartworm prevention, without the cosmetic concerns some owners have about residue from topical products. Compliance with oral products can be challenging in cats who resist pilling, making topical products the more popular choice. The year-round versus seasonal prevention question parallels the flea prevention discussion from an earlier comparison. In regions with year-round mosquito activity, year-round heartworm prevention is clearly appropriate. In regions with distinct winter seasons where mosquitoes are not active for several months, seasonal prevention may be adequate. though the American Heartworm Society recommends year-round prevention for all cats, regardless of location, to eliminate any gaps in protection and to simplify compliance. The cost of heartworm prevention for cats ranges from $10 to $20 per monthly dose, depending on the product and whether additional parasite coverage is included. Annual cost of $120 to $240 is modest, relative to the cost of treating heartworm-related illness if infection occurs, though, as with all preventive medications, the cost accumulates over years, and many cats never experience heartworm exposure despite years of prevention. Let's examine the risk assessment for individual cats and how to determine whether heartworm prevention is justified based on location and lifestyle. High-risk cats who clearly benefit from prevention. Cats in southeastern United States, Gulf Coast states, and Mississippi River Valley, where heartworm prevalence is high. Cats with any outdoor access in endemic regions. Cats traveling to endemic regions or relocating from low prevalence to high prevalence areas. Cats in households with dogs who are heartworm positive or who are not on prevention. Lower risk cats where prevention may be optional. Cats in arid regions. With minimal mosquito populations, strictly indoor-only cats in regions with very low documented heartworm prevalence, cats in northern regions with short mosquito seasons where seasonal prevention may be adequate. The risk tolerance consideration is individual. Some owners are comfortable accepting low risk and managing cats without heartworm prevention in low prevalence areas, while others prefer eliminating all preventable risk, regardless of prevalence. The severity of heartworm disease in cats and the lack of effective treatment creates strong argument for prevention even in low prevalence areas, because the consequence of infection is potentially death, and prevention is relatively inexpensive and safe. The veterinary recommendation in most practices is year-round heartworm prevention for all cats, reflecting the American Heartworm Society guidelines and the recognition that heartworm has been documented throughout the United States and that even low prevalence areas have some risk. Owners who choose to decline heartworm prevention should do so based on informed assessment of local prevalence and individual risk factors, rather than based on assumptions that indoor-only cats are not at risk or that heartworm does not occur in their region. The testing before prevention question arises because some heartworm prevention products are not safe to use in cats who are already infected with adult heartworms. Testing before starting prevention is recommended in cats over 6 months of age who have not been on prevention or who have gaps in prevention history, though testing in cats is less reliable than in dogs, and negative tests do not definitively rule out infection. The verdict heartworm prevention is strongly recommended for all cats in high prevalence regions, including the southeastern United States, Gulf Coast states, Mississippi River Valley, and Atlantic coastal states, where mosquito populations are large and heartworm is endemic in dog populations. Heartworm prevention is reasonable and prudent for cats in low prevalence regions, including the desert Southwest, mountain states, and northern states, particularly for cats with any outdoor access or in households with dogs who may serve as heartworm reservoirs. Year-round prevention is preferred over seasonal prevention because it eliminates gaps in protection and simplifies compliance, though seasonal prevention may be adequate in regions with true winter seasons, where mosquitoes are inactive for extended periods. Indoor-only status reduces, but does not eliminate heartworm risk, and prevention is still beneficial for indoor cats in endemic regions. If you live in the southeastern United States, along the Gulf Coast, or in the Mississippi River Valley, implement year-round heartworm prevention for your cats immediately. The prevalence in these regions is high enough that prevention is clearly cost-effective, and the risk of infection in unprotected cats is substantial. If you live in other regions, discuss local heartworm prevalence with your veterinarian and make an informed decision about whether prevention is justified based on documented cases in your area. If your veterinarian recommends prevention and you live in a region where mosquitoes are present, implement it rather than assuming your region is safe. Heartworm prevention is safe, relatively inexpensive, and provides protection against a disease that is untreatable in cats and often fatal. The cost-benefit analysis favors prevention for most cats in most locations, and the peace of mind from knowing your cat is protected from this devastating disease justifies the modest annual cost. Comparison 9. Nail trimming, home versus professional. Nail trimming is one of the routine maintenance tasks that indoor cats require to prevent overgrown nails from causing discomfort, mobility problems, and injury to the cat or to household members. Outdoor cats naturally wear down their nails through climbing, scratching on trees, and walking on rough surfaces, which keeps nails at appropriate length without human intervention. Indoor cats do not have access to these natural nail-wearing activities, and even with scratching posts available, the nails continue growing and require regular trimming to prevent them from becoming so long that they curve into the paw pads, snag on fabrics, or cause difficulty walking. The question for cat owners is whether to trim nails at home as part of routine care, or whether to have nails trimmed professionally at veterinary clinics or grooming facilities where the cat is restrained by experienced staff who can complete the procedure quickly despite the cat's resistance. This comparison examines what proper nail trimming involves and what the risks of improper technique are, what the advantages and challenges of home nail trimming are compared to professional trimming, how to train cats to tolerate nail trimming, and what to do when training fails, and how to make informed decisions about nail care based on your cat's temperament, your confidence in performing the procedure, and the cost and logistics of professional trimming. Let's start with what proper nail trimming involves and why technique matters, because improper trimming can cause pain, bleeding, and long-term fear of the procedure that makes future trimming increasingly difficult. Cat claws have a curved structure with a hard outer shell and a soft inner core called the quick that contains blood vessels and nerves. The quick extends partway down the nail, and proper trimming removes only the sharp curved tip of the nail beyond where the quick ends, leaving the quick intact and undamaged. Cutting into the quick causes pain and bleeding, creates negative associations with nail trimming that increase the cat's resistance to future trimming, and can lead to infection if the cut quick is not properly cleaned and monitored. The visibility of the quick varies by nail color. Cats with white or light-colored nails have visible pink quick that can be seen through the translucent nail, making it easy to identify where to cut. Cats with black or dark nails have quick that is not visible, requiring the person trimming to estimate where the quick ends based on nail curvature and experience. The risk of cutting the quick is higher with dark nails than with light nails, and conservative trimming that removes less nail is safer than aggressive trimming that attempts to cut as close to the quick as possible. The trimming tools include guillotine-style clippers that have a circular opening where the nail is inserted and a blade that slides across to cut the nail, and scissor-style clippers that cut the nail with a scissors motion. Both types work effectively when sharp and properly used, and the choice between them is largely personal preference. Dull clippers crush rather than cut nails, causing splitting and discomfort, so clippers should be replaced when they no longer cut cleanly. The restraint technique affects whether the procedure is stressful or manageable for both cat and owner. Gentle restraint with the cat positioned comfortably in the owner's lap or on a stable surface, with minimal force and no yelling or punishment, creates better cooperation than forceful restraint that triggers fear and defensive aggression. Some cats tolerate nail trimming with minimal restraint if they have been trained from kittenhood to accept handling, while other cats require firm restraint or even towel wrapping to prevent escape and to protect the owner from scratches. The frequency of nail trimming depends on how quickly the cat's nails grow and how much natural wearing occurs through scratching. Most indoor cats benefit from nail trimming every 2 to 4 weeks, though some cats require more frequent trimming and others can go longer between sessions. The goal is to prevent nails from becoming long enough to cause problems rather than waiting until overgrowth is severe before addressing it. Now let's talk about home nail trimming and what the advantages and challenges are. Home nail trimming allows the owner to trim nails on a schedule that matches the cat's nail growth rate and at times when the cat is relaxed and receptive, rather than being constrained by clinic appointment availability. Home trimming is also significantly less expensive than professional trimming because there are no service fees beyond the initial investment in nail clippers, and it eliminates the stress of transport to veterinary clinics or grooming facilities for cats who find travel and clinic environments anxiety-provoking. The bonding opportunity through gentle handling during nail trimming can strengthen the owner-cat relationship when done correctly with positive reinforcement and respect for the cat's tolerance limits. Cats who learn to accept nail trimming as part of routine care from their owners often show less stress during the procedure than cats who only experience nail trimming at veterinary clinics, where the environment is unfamiliar and where other stressful procedures may also occur. The training requirement for successful home nail trimming is real and is the primary barrier that prevents many owners from implementing home trimming. Cats do not naturally accept having their paws handled and their nails manipulated, and teaching a cat to tolerate nail trimming requires gradual desensitization, starting with brief gentle paw touches, progressing to holding individual paws and extending nails, introducing the sight and sound of clippers without cutting, and finally trimming 1 or 2 nails at a time while providing treats and praise for cooperation. The training timeline for cats who have never experienced nail trimming is weeks to months of consistent daily or every other day practice sessions that build tolerance incrementally. Rushing the training by attempting to trim all nails before the cat is comfortable creates negative associations that make future training more difficult and that may result in permanent resistance to nail trimming. The patience required for proper training is substantial, and many owners give up and resort to professional trimming, rather than investing the time in training. The technique confidence barrier affects owners who are nervous about cutting the quick and causing pain or bleeding. The fear of harming the cat can make owners hesitant and tentative during trimming, which prolongs the procedure and increases the cat's stress as they wait for the cut that the owner is delaying. Building confidence through practice on cooperative cats or through guidance from veterinary staff during demonstration trimming sessions helps owners overcome this barrier. The risk of injury to the owner from scratching or biting during restraint is real, particularly with cats who are not trained to accept nail trimming and who resist forcefully. Scratches and bites from stressed. Cats can be deep and can become infected, requiring medical attention in some cases. Owners who have been injured during previous nail trimming attempts are understandably reluctant to repeat the experience, creating pressure to seek professional trimming instead. Now let's talk about professional nail trimming and what it provides that differs from home trimming. Professional nail trimming at veterinary clinics or grooming facilities is performed by staff who have experience restraining cats and who can complete trimming quickly even when cats resist. The speed and efficiency of professional trimming minimizes the duration of stress for the cat, and the experience of the staff reduces the likelihood of cutting the quick or causing injury through improper technique. The restraint capability at professional facilities includes staff who are trained in safe cat restraint techniques and who work in teams where one person restrains while another person trims, allowing faster completion than a single person working alone can achieve. Some facilities use gentle restraint wraps or other tools that limit the cat's ability to struggle while minimizing fear and pain. The cost of professional nail trimming ranges from $10 to $30 per session depending on the facility and geographic location, which translates to $120 to $360 annually if trimming occurs monthly. For owners who cannot or will not perform home trimming, this cost is worthwhile to ensure that nail trimming occurs regularly. Though for owners on tight budgets or with multiple cats, the cumulative annual cost of professional trimming for all cats can be substantial. The clinic visit requirement for professional trimming creates both logistical burden through the need to schedule appointments and transport the cat, and stress for cats who find travel and clinic environments anxiety-provoking. Some cats who tolerate the actual nail trimming procedure will still, experience significant stress from the transport and clinic visit, raising questions about whether the stress cost outweighs the benefit of having nails trimmed professionally rather than at home where no travel is required. The sedation option for extremely resistant cats is available at veterinary clinics, but not at grooming facilities, and it provides a solution for cats who cannot be safely trimmed while awake due to extreme aggression or panic. Sedation for nail trimming is not ideal because it requires anesthesia with associated risks and costs, but for cats who would otherwise go untrimmed due to inability to restrain them safely, sedation allows necessary nail care to occur. Sedation is typically reserved for situations where nail trimming can be combined with other procedures requiring sedation, such as dental cleaning, making the sedation serve multiple purposes rather than being used solely for nail trimming. Let's examine the specific situations where home versus professional trimming is clearly preferable. Home nail trimming is preferable for cats who have been trained from kittenhood to accept nail trimming and who cooperate with minimal restraint, owners who are confident in trimming technique and who can restrain their cats safely, cats who experience severe stress from travel or clinic visits, multiple cat households where the cost of professional trimming for all cats is prohibitive, owners who want to build handling and cooperation skills with their cats. Professional nail trimming is preferable for cats who resist home trimming attempts violently and who pose injury risk to owners, owners who lack confidence in trimming technique and who fear cutting the quick cats with dark nails, where quick visibility is poor and professional experience improves safety, senior or arthritic cats who have difficulty tolerating the restraint required for home trimming, situations where the cat already visits veterinary or grooming facilities regularly for other services, the combination approach where most trimming occurs at home, but occasional professional trimming provides verification, the technique is correct, and that nails are being maintained at appropriate length is used by some owners and provides a middle ground between exclusive home care and exclusive professional care. The scratching post provision, as partial alternative to frequent trimming, helps maintain nail condition and provides some natural wearing. Those scratching posts alone do not eliminate the need for trimming in most indoor cats. Providing multiple scratching posts with different textures, including sisal, cardboard, and carpet, allows the cat to choose preferred scratching surfaces and increases scratching frequency, which may extend the interval between necessary trimming sessions. The declawing consideration arises in discussions of nail care challenges. But declawing is not an acceptable alternative to regular nail trimming. Declawing is amputation of the last bone of each toe and causes chronic pain, behavioral problems, and welfare harm that is never justified by avoidance of nail trimming difficulty. Declawing is banned or considered unethical in many countries and by major veterinary organizations, and it should never be considered as a solution to nail care challenges. The verdict home nail trimming is the preferred approach for cats who can be trained to tolerate the procedure, and for owners who are willing to invest time in training and who are confident in trimming technique. The cost savings, convenience, and avoidance of clinic visit stress justify the effort required to establish successful home trimming. Professional nail trimming is a reasonable option for cats who resist home trimming violently, for owners who lack confidence or who have been injured during previous trimming attempts, and for cats whose temperament makes safe restraint at home impossible. The training investment for home nail trimming is worthwhile and should begin in kittenhood when possible, using gradual desensitization and positive reinforcement to build tolerance before trimming is actually necessary. Even adult cats can be trained to accept nail trimming with patience and consistent practice, though the timeline is longer than with kittens. If you currently rely on professional trimming, but your cat tolerates handling well and shows no extreme fear or aggression, consider attempting home trimming with proper training. Ask your veterinarian to demonstrate technique during your cat's next visit. Practice paw handling and nail extension at home without cutting for several weeks, and attempt trimming 1 or 2 nails during sessions when your cat is relaxed, gradually building to full nail trimming sessions as tolerance improves. If you attempt home trimming and cut the quick causing bleeding, apply styptic powder or cornstarch to stop bleeding. Remain calm and do not punish the cat, and continue. Training with shorter practice sessions that rebuild trust. Cutting the quick is a learning experience that helps you identify where the quick is located and does not mean home trimming is impossible. If your cat is truly resistant to nail trimming, despite proper training attempts, and poses genuine injury risk, accept that professional trimming is necessary for your safety and for the cat's welfare. Attempting to force home trimming on a cat who cannot tolerate it creates ongoing stress and potential for injury that outweighs the cost and logistical burden of professional care. Nail trimming is essential care that prevents painful overgrowth and maintains your cat's comfort and mobility. Implement it either at home or professionally, but implement it consistently on a schedule that keeps nails at appropriate length throughout your cat's life. Comparison 10. Ear cleaning. Regular versus as needed. Ear care in cats occupies a strange position in preventive health discussions, where it is simultaneously overemphasized in some contexts, with owners and groomers performing routine cleaning on ears that do not need it and potentially causing irritation through excessive manipulation, and underemphasized in other contexts, with ear problems going unrecognized and untreated until infections are advanced and painful. The question of whether cats need regular preventive ear cleaning, similar to how dogs with floppy ears need routine ear care to prevent moisture accumulation and infection, or whether cat ears should be cleaned only when problems arise and cleaning is medically indicated, reflects fundamental misunderstanding about feline ear anatomy, about what normal ear appearance and function are, and about what ear cleaning actually accomplishes versus what risks it creates when performed unnecessarily. This comparison examines what normal cat ear anatomy and self-cleaning function are, what conditions genuinely require ear cleaning, and what cleaning accomplishes in those situations, what the risks of unnecessary ear cleaning are, and how to make informed decisions about ear care based on your cat's individual ear health, rather than on assumptions that routine preventive cleaning is beneficial. Let's start with feline ear anatomy and why cats' ears function differently than dogs' ears in ways that affect cleaning needs. Cat ears have a relatively open structure with upright pinnae that allow good air circulation into the ear canal, unlike dogs with heavy floppy ears that trap moisture and restrict airflow. The ear canal in cats is L-shaped with a vertical portion descending from the ear opening and a horizontal portion leading to the eardrum, and the canal is lined with skin that produces ceramin, commonly called earwax, which traps debris and helps protect the ear canal from infection. The normal self-cleaning mechanism of cat ears involves gradual migration of ceramin and trapped debris from the inner ear canal toward the outer opening, where it accumulates as visible wax in the outer ear that can be gently wiped away if desired, but that does not require cleaning. This self-cleaning system works effectively in healthy ears, and interfering with it through frequent deep cleaning can disrupt the natural protective mechanisms and can push debris deeper into the canal rather than removing it. The normal ear appearance in healthy cats includes a small amount of light brown or tan ceramin, visible in the outer ear, pink healthy skin with no redness or swelling, no odor or only very mild natural ear smell, and no discharge or excessive wax accumulation. Ears should not appear completely clean with zero ceramin visible, because complete absence of ceramin suggests either that the ears have been over-cleaned or that ceramin production is abnormal. A small amount of wax is normal and healthy. The abnormal ear signs that indicate problems requiring veterinary attention rather than routine cleaning include dark brown or black, waxy debris that resembles coffee grounds and that indicates ear mites, red or swollen ear canal tissue indicating inflammation or infection, yellow or green discharge indicating bacterial infection, foul odor indicating infection, excessive head shaking or ear scratching indicating discomfort, and visible crust or scabs on the ear flap indicating trauma or skin disease. Now let's talk about regular preventive ear cleaning and what it involves and what it is claimed to accomplish. Regular preventive ear cleaning means using ear cleaning solution and cotton balls or gauze to remove cerumen from the outer ear, and sometimes from the ear canal on a scheduled basis, such as weekly or monthly, regardless of whether the ears appear dirty or whether any problems are present. The cleaning is performed with the assumption that removing wax prevents the accumulation that could lead to infections, similar to how some owners perform regular teeth brushing to prevent dental disease. The ear. Cleaning solutions marketed for routine use in pets are typically gentle solutions containing ingredients like salicylic acid, acetic acid, or various surfactants that help dissolve and remove cerumen. The solutions are applied to the ear canal is massaged to distribute the solution, and then the ear is wiped with cotton to remove dissolved wax and debris that has migrated to the outer ear. The claimed prevention benefit is that removing cerumen before it accumulates heavily reduces the environment where bacteria and yeast can multiply, theoretically preventing infections from developing. This claim assumes that cerumen accumulation is a precursor to infection and that removing cerumen proactively reduces infection risk. The reality is that normal cerumen production is protective rather than harmful, and removing cerumen disrupts the ear's natural defense mechanisms. Cerumen creates a slightly acidic environment that inhibits bacterial and yeast growth, and it traps debris and prevents it from reaching the deeper ear canal. Removing cerumen through routine cleaning eliminates these protective effects and can actually increase infection risk if the cleaning process introduces moisture or damages the ear canal lining. The irritation risk from cleaning solutions and from the mechanical action of wiping the ear canal is real, particularly when cleaning is performed frequently. The skin lining the ear canal is delicate and can become irritated, inflamed, or damaged by repeated cleaning, creating conditions that predispose to infection rather than preventing it. Cotton swabs, which some owners use despite warnings against them, can push debris deeper into the ear canal, can damage the eardrum if inserted too deeply, and can cause trauma to the ear canal tissue. Now let's talk about as-needed ear cleaning, and when it is medically appropriate rather than routine prevention. As-needed ear cleaning means cleaning ears only when specific problems are identified that make cleaning necessary, such as ear mite infestation requiring removal of mite debris before medication application, ear infection requiring removal of discharge and debris so that topical antibiotics can reach infected tissue, or excessive cerumen accumulation that is abnormal and that is causing discomfort or contributing to infection risk. In these situations, ear cleaning is a medical treatment rather than prevention, and it serves specific purposes that justify the intervention. The veterinary prescribed ear cleaning for medical conditions uses specialized cleaning solutions that are selected based on the specific problem being treated. For ear mite infestations, cerumenolytic solutions that dissolve the thick, dark debris produced by mites are used to clear the ear canal before mite treatment is applied. For bacterial infections, antibacterial solutions may be used along with debris removal so that topical antibiotics can contact infected tissue effectively. For yeast infections, antifungal solutions may be combined with cleaning to address both the overgrowth and the conditions that allowed it to develop. The frequency of as-needed cleaning is determined by the specific condition and by the treatment protocol. Ear mite treatment may require daily cleaning for 1 to 2 weeks to remove debris as mites are killed. Ear infection treatment may require cleaning every few days initially, and then less frequently as the infection resolves. The cleaning continues only as long as medically necessary, and it stops when the problem is resolved and the ears return to normal self-maintaining function. The technique for medical ear cleaning involves filling the ear canal with cleaning solution, massaging the base of the ear to distribute the solution and loosen debris, allowing the cat to shake their head to expel loosened material, and then wiping the outer ear with cotton or gauze to remove expelled debris. Deep insertion of cotton swabs or other tools into the ear canal is not part of appropriate cleaning technique and should be avoided because it risks trauma and debris impaction. The professional ear cleaning performed by veterinarians during treatment of severe ear infections or during diagnostic procedures uses specialized tools including video otoscopes that allow visualization of the deep ear canal and tympanic membrane, and it may include flushing the ear canal under sedation or anesthesia to remove debris that cannot be accessed safely in an awake cat. This level of ear cleaning is medical intervention for specific diagnosed problems and is not routine preventive care. Let's examine the specific conditions where ear cleaning is genuinely necessary versus situations where ears should be left alone. Ear cleaning is necessary for ear mite infestation, requiring debris removal before and during treatment, bacterial or yeast ear infections, requiring removal of discharge and debris so that medications can reach infected tissue, foreign material in the ear, such as plant material or dirt that cannot be expelled naturally, excessive abnormal cerumen production that is causing obstruction or contributing to recurrent infections. Ear cleaning is not necessary for normal healthy ears with small amounts of cerumen and no signs of infection or discomfort, cosmetic purposes to make the ears look cleaner when no medical indication exists, preventive purposes based on assumptions that regular cleaning prevents problems when no evidence supports this practice. The breed-specific consideration arises because some cat breeds, including Sphinx cats and other hairless or partially hairless breeds, produce more cerumen than typical cats and may benefit from more frequent ear cleaning than average cats. However, even in these breeds, cleaning should be based on actual accumulation levels and should be performed only when cerumen buildup is excessive, rather than on an arbitrary schedule. The ear mite prevention question is sometimes raised in discussions of routine ear cleaning, with the assumption that regular cleaning might prevent ear mite infestations. The reality is that ear mites are transmitted through direct contact with infested cats, and cleaning does not prevent transmission. Preventing ear mites requires avoiding contact with infested cats and using parasite prevention medications that include mite protection, not routine ear cleaning. The owner observation and monitoring approach is the appropriate alternative to routine preventive ear cleaning. Checking your cat's ears weekly by gently folding back the ear flap and looking at the visible portion of the ear canal allows early detection of problems, including redness, swelling, discharge, excessive wax, or odor that indicate the need for veterinary examination. Visual checks do not require cleaning and do not risk causing irritation or disrupting normal ear function. The warning signs that ears should be examined by a veterinarian include any of the abnormal ear signs mentioned earlier, dark debris resembling coffee grounds, red or swollen tissue, discharge, odor, excessive head shaking, ear scratching, holding the head tilted, or visible crust on the ear flap. These signs indicate medical problems that require diagnosis and treatment, not routine cleaning. The verdict: regular preventive ear cleaning is not necessary for most cats and can cause more problems than it prevents by disrupting normal ear self-cleaning function, irritating delicate ear canal tissue, and introducing moisture that can promote infection. Healthy cat ears maintain themselves through natural cerumen migration and do not require routine cleaning intervention. As-needed ear cleaning, when specific medical problems are diagnosed, is appropriate and necessary for conditions including ear mite infestations and ear infections, where debris removal facilitates treatment and recovery. Medical ear cleaning should be performed according to veterinary guidance using appropriate solutions and techniques. The appropriate ear care for most cats is periodic visual inspection to monitor for problems combined with gentle external wiping, with a soft cloth to remove visible cerumen from the outer ear if desired, with no deep cleaning or frequent intervention unless medical problems develop. If you are currently performing routine preventive ear cleaning on your cat's healthy ears, stop doing this and switch to visual monitoring only. The cleaning is not beneficial and is potentially harmful, and your cat's ears will function better without interference. If you notice any abnormal signs in your cat's ears, including dark debris, redness, discharge, odor, or excessive scratching. Schedule a veterinary examination for diagnosis and appropriate treatment, rather than attempting to clean the ears yourself. Ear problems require specific treatments based on the underlying cause, and inappropriate cleaning can worsen problems or mask symptoms that the veterinarian needs to see to make accurate diagnosis. If your veterinarian diagnoses an ear problem and prescribes cleaning as part of treatment, follow the prescribed protocol exactly, including solution type, cleaning frequency, and technique. Medical ear cleaning is appropriate when medically indicated, and it should continue for the prescribed duration even if the ears appear to improve before treatment is completed. Leave healthy ears alone. Monitor them visually. Seek veterinary care when problems arise. This simple approach provides better ear health outcomes than routine preventive cleaning that is based on misunderstanding of normal ear function, and that creates problems in the attempt to prevent them. Closing 10 health and prevention decisions. 10 times where the standard advice you have heard or the routine protocols your veterinary clinic follows turn out to be more complex than you realized, and where understanding the nuance allows you to make better choices for your cat's health and for your budget. You now understand that dental disease is preventable through daily toothbrushing in ways that dental treats cannot match. The vaccination protocol should be based on evidence about immunity duration, rather than on arbitrary annual schedules, and that parasite control strategies should match your cat's actual exposure risk, rather than following one-size-fits-all recommendations. You know that flea prevention decisions depend on climate and housing type. The blood work frequency should increase as cats age and disease risk rises. That microchipping provides superior permanent identification compared to tattooing. And that pet insurance decisions require honest assessment of your financial discipline and your cat's pre-existing condition status. You understand that heartworm prevention is essential in endemic regions, even for indoor cats. That nail trimming at home is achievable with proper training, but professional trimming is reasonable when training fails. And that routine preventive ear cleaning causes more problems than it prevents in healthy ears. These 10 comparisons represent the preventive care decisions that determine whether your cat lives 15 years or 20 years, whether they develop preventable chronic diseases in middle age or remain healthy into their senior years, whether the money you spend on their care is invested in interventions that actually work or wasted on products and services that provide minimal benefit. The pattern across these comparisons is clear. Effective prevention requires individualized assessment rather than blanket protocols. It requires understanding what interventions actually accomplish versus what they are marketed to accomplish. It requires knowing when more frequent intervention provides genuine benefit and when it is unnecessary expense. And it requires the confidence to question veterinary recommendations when they do not align with current evidence or with your cat's specific risk factors. Health and prevention decisions are not made once. They are made continuously throughout your cat's life as circumstances change, as new evidence emerges, and as your cat ages and their needs evolve. The foundation you have built through this video allows you to make those decisions informed by evidence rather than by fear, marketing, or habit. Part 5 is complete. 58 comparisons across 5 videos. You have covered nutrition, behavior, environment, specialized care, and now health and prevention. The breadth of knowledge you have accumulated places you in the top fraction of 1% of cat owners globally. If these comparisons have changed how you approach your cat's preventive care, subscribe to this channel. Parts 6 through 10 are coming with 60 more comparisons, covering feeding strategies, behavioral decisions, environmental enrichment, medical choices, and multi-cat dynamics. Leave a comment telling us which health decision you are changing based on what you learned today. Your cat's health is in your hands. After 58 comparisons, you are equipped to protect it. We will see you in the next one, cat lovers.